Well, good morning, everybody. Thank you for hopping on to Western Marketing's ACA Kickoff event for the 2025 season here. We got definitely have a long day ahead of us. I have this webinar here set up for 10 o'clock Central Time, and we're going all the way to 3:30. So it is definitely going to be a long one, but ton of good information, ton of good carriers. As you can see here, we got a lot of carriers that are going to be on this, presenting their national footprint for you guys. First one, we're going to start off with Mr. Andy Larson over with Allstate, and he's going to do a little bit of a demo for you guys on their partnership this year with Health Sherpa. So with that, Andy, go ahead and take it away.
Taylor, good morning. Thank you for having me. Hopefully you can see my screen all right.
Yes, sir.
Perfect. All right. Well, good morning to all of you, and thank you for coming to the Western Marketing Kickoff. I'm happy to be a part of this here today. And Allstate Health Solutions. Again, Taylor mentioned my name is Andy Larson. I'm a field vice president here with Allstate Health Solutions. Maybe I've met some of you all on the trips over the years, but at the end of the day, today, I'm not going to here today to talk about ACA plans through Allstate Health Solutions. We are still not an ACA carrier, but today discuss ideas on how to build better solutions for your ACA clients and look at the global package that we're putting together and solving for all of the reasons why your client might be left sleeping at night due to their health insurance plan. So as we sit here, we're going to be looking at all the different ACA carriers in the market. You're going to be thinking about, okay, what does each one have to offer, so on and so forth. But at the end of the day, our job as advisors is to find the best solution for our clients. And in most cases, the ACA plan is that best solution. But even the best ACA solution in that market, wherever you're at, can come with anywhere from up to a $9,000 gap. And that's in the form of the out-of-pocket exposure. So in 2025, it's actually gone down a little bit, but it's still pretty high. Your client could be exposed anywhere up to $9,200 or $18,004 for a family. So as you talk about the best plans that are in the market and we find that best price point, I encourage you to take into account, okay, well now what happens when our clients actually need the plan to work for them the most? And that is at the time of claim. Whether that's just a general claim or perhaps reality is some of these plans we look at might have out-of-network limitations or maybe have ×2 for their out-of-network exposure. And if there's any limits on experimental treatment for maybe a complex diagnosis, the concepts we're going to talk about today are going to help reinforce and support all the options that you hear about this morning and this afternoon. With Allstate Health Solutions, working with us, you get our full suite of products under and over 65. But today, we're going to talk about a solution that is going to help you not only write ACA, but also add an accident plan, a dental plan, maybe look at critical illness, a cancer, heart, stroke plan, hospital plan. As you advise your clients on the best possible solution to meet all of their needs, not only premium-wise, but when they need it most at the time of claim, we have many solutions that can customize or tailor-make a health plan for your client that's going to keep them satisfied with the service that you provide, can lead to more referrals, can all the while earn you more revenue this year while being a better agent in the process. So what we've done here today to help make it easy for you to not only do your ACA plans, but also create that customized solution with supplemental. We have partnered with Health Sherpa to create a pathway through the Allstate website where you can create a bundled shopping cart and a single price point experience to create that package of solutions with not only the ACA plan, but perhaps an accident plan, a dental plan, so on and so forth. Now, if you're already using Health Sherpa today, this solution is available to you as well. If you're already, if you are not using Health Sherpa today, this could be a potential way for you to get into the Health Sherpa world, but also look at Allstate as well if you're familiar with the Allstate site. What this is going to be a white labeled version of Health Sherpa dedicated to Allstate agents that are contracted today. So when this goes online, we're still going through 1 or 2 more CMS approvals to test out and iron out. So we anticipate within the next week or 2 will be online. Once this is online, you will receive a credential to create your white labeled version. Again, if you're using Health Sherpa today, it's going to look exactly the same. So you're going to have the same functionality, the same user endpoints, so on and so forth. But from the quoting experience on the front end, going through the Allstate site will allow you to create that bundled package of solutions. Allstate is not putting products on Health Sherpa. Health Sherpa is coming to the Allstate site. So when you take a look at this, you look at, say, a good example here would be like a Health Sherpa plan, ACA, whatever that flavor is, and then you look at all the different options behind it to create that single shopping cart experience. So with this, Taylor, I'm going to flip screens here. Let me know if you can see my Google Chrome. Is it popped up there?
Yes, sir. You're good.
Perfect. Okay. So mechanically, when you go in, year 1, just for sake of, there's going to be some enhancements over time with more single sign-on features. But if you're a utilizer of Health Sherpa today, you're going to sign in just like you normally would. And if you see this email address here, this is going to be similar to a credential you'll receive. So it might be taylor.gardner plus Allstate at healthsherpa.com. Simply log in. And as you see here, as you log in, it's going to look exactly the same as what you might experience already with Health Sherpa. Only difference here is that you're going to see Allstate Health Solutions up at the top. Now, if you do have an existing Health Sherpa account today, just keep in mind that any data that you might have in your existing Health Sherpa account will not be found in this account unless you do an import or an export of the data of that account and import it into the white label. There are instructions on our team resource page to do this export and import. If you're not going to write supplemental plans, although we encourage you to talk about it with every client to educate them and provide them that right of refusal, then this probably isn't for you. Keep the existing Health Sherpa account that you have. But if, as we go through this demonstration and you see the quoting pathway and the connection points between Allstate site and Health Sherpa, it might make sense for you to say, you know what, let me try this out. So that way, every single plan that I quote, I'm going to create a bundled solution, let my client give me that right of refusal, and then go from there. So once you've logged in for the day, and if you aren't logged in, you will be prompted to when you go to enroll. So now we're opening up a tab to the Allstate Health Solutions site. So if you're using Allstate Health site today, this looks very familiar. So if you're using Sherpa, using Allstate, these are 2 familiar sites. So first and foremost, I'm going to put in an effective date. We'll just put in for sake of demonstration. Date of birth, gender, and if we needed to add any spouses or dependents, we go from there. So it looks just the same as you would logging into Allstate any other time that you might have come to our platform. Where you're going to want to go though next is Health on Exchange. And Health on Exchange is where you'll be able to get that subsidy determined. First, there's going to be some consent. There's going to be a lot of consent that you're going to hear about this year with Health Sherpa. Second question is tobacco. Household size is 1. Let's just say for sake, we have a $40,000 income. Starting this plan on November 1st, and now we're going to show plans. As you see here, you can still edit the client information, but now we have eligible for subsidy. Household size is 1. That estimated subsidy and cost share reduction will be listed there as well. In this market, we have Arizona. We have 109 plans that are on exchange today. To narrow that down to carriers that you are contracted with, and this might be a good jump off point to say, you're not getting your ACA contracts through Allstate, you're getting them through Western Marketing. So with that being said, if you look at the filters that we have, you have all the different carriers that are available in this particular market. If you're only contracted, say, with United Healthcare or Imperial Insurance or Oscar, you would perhaps maybe want to just filter down to those carriers. So let's just do that for real quick for sake of the demonstration. You can choose by network type, deductibles, so on and so forth, star rating, and you can also clear all the filters if you want. So in this case, you can scroll down and look at each one of the 100 and some plans. This is zoomed in to about 150% just for demonstration. You can look at the provider directory for each carrier. So in this case, United Healthcare Bronze. You can get more details by looking at some of the different inpatient, primary care, member experiences, plan benefits. You can toggle from there, looking at the drugs, looking at emergency care. You can download the benefit summary or even a brochure, all right there for you. Okay. If you wanted to do a comparison, you can take that plan and then let's maybe take second plan, third plan. You can compare all three plans and you'll see all the different benefits down the side or in a compressed bar. Open those up and then you can do that comparison. So let's just say you're right here and you want to look at the bronze value HSA plan. Your client likes the HSAs. Add that to the cart, or you can add it to the cart up here as well. So you can either remove that, add it back to the shopping cart. What I think I'm going to do though is I'm going to reduce this a little bit so we get a little bit better view of the shopping cart. So over here we have our shopping cart. So we have $102.48. I'm going to get rid of that though. Okay, so we have our shopping cart, $102.48. We have a $6,700 deductible, no co-insurance after deductible. Original price was $300, $198 subsidy. Off we go. So as we think about, again, on every single client that we talk about, if we bring up or ask the questions up front, Mr. or Miss Client, who is your accident plan with? Mr. or Miss Client, who's your cancer plan with? Before you even talk about features and benefits, chances are that in their head, they're going to be thinking, well, I don't have an accident plan or a cancer plan. Should I have a cancer plan? We kind of live in a FOMO world. And if you present it that way, it might open up you open the door for that conversation to say, we're going to create a solution that is going to address all the needs that you might be concerned about. You play bar league sports, worried about getting hurt, let's solve for that. You have family history of cancer, let's solve for that. So the first place I'm going to go is I'm going to look at accident plans. And we have a plan called the Plan Enhancer, which is an accident medical expense, but has optional riders for cancer, heart attack, and stroke, and hospitalization due to sickness if your client is hospitalized, admitted for 24 hours. So from that perspective, it covers the trilogy of things that you might be concerned about as it pertains to a high out-of-pocket expense. So we start with the accident plan. So in this case, we know we have a $6,700 out-of-pocket. So now we've taken we'll look at a $6,000 benefit. Now we reduce that out-of-pocket to $700 for an accident, cancer, heart attack, stroke, or a hospitalization due to sickness. It will pay in all three buckets. So we'll add that to the cart. In this case, let's just add, we're going to add both of the riders here. Okay. So let's add that to the cart. And so now we have a combined shopping cart of $162.57. But we have a guaranteed issue plan that's going to offset $6,000 in the event of cancer, heart attack, stroke, hospitalization for 24 hours admitted, and accidents. Now, the $102.48, that's going to go to United Healthcare. The $60.09, that's going to go to Allstate. Now we're thinking about this. Okay, well, you have teeth, perhaps you need a dental plan. Well, let's take a look at our Prime dental plan that covers no waiting period for basic or major services, day one coverage, optional vision. Let's just skip the vision for now. But as you'll see here in the shopping cart, we took a discount. On our dental plans, there's a 15% discount on the premium if you combine it with any other Allstate plan. So for $100 extra dollars, your client is protected against their out-of-pocket, and they have a great dental plan that's going to be $0 preventive. We'll have coverage for basic and major services day one, nationwide network with the Aetna Dental Administrators Network. Client says, you know what, I was really kind of hoping to keep it under $200, but $203.91, that sounds great. So 102 goes to United Healthcare, 101 goes to Allstate Health Solutions. So now we're still in Allstate. You're thinking, okay, Andy, where does Health Sherpa come into this? Why we're just seeing on exchange plans? Well, before we go to Health Sherpa, just keep in mind, Health on Exchange will always be there for you to quote and enroll. So if you wanted to create a bundled package, even though you don't use Health Sherpa, maybe use another solution, you can always come to our site to create that bundled package. But if you're using Health Sherpa and you're logged into the white labeled version, at this point, we're going to simply click apply. And when you hit apply, this is where the magic happens when we go into the application for Health Sherpa. So if you're familiar with Health Sherpa, this spot looks familiar to you. So you're going to simply put in the name of the client, date of birth. This was in Arizona. And then now you look at your consumer consent. So we're going to search the marketplace. So this is the portion here now where if the client is in your Health Sherpa, you will find that client in here. They're already in your dashboard, so you can pick up where you left off. It's only if you export your data from your existing Health Sherpa account into the white label. If you if this is a new client for you, you're creating a new application, and for sake of demonstration, create new application. So this is where you look at some of the more consent things, so on and so forth, that are going to be in there. This is all familiar to you if you're using Health Sherpa today. So as you go from here, it's the normal process. So let's just say, for example, have the consent. I'll upload it on my dashboard, or I'll already have proof of my own records. Continue. And now you see all the different sections that you would normally utilize with Health Sherpa. For sake of having only about another 5-10 minutes here, I'm not going to go through the full process on this. But what I want to do is show you the next connection point. So let's say you check the box on all of these different sections in Health Sherpa. Your client is on board with the Allstate products. Now we just simply have to return to Allstate in the upper right corner here. Click Return to Allstate. And that will land you in the application for those products. Now, just because CMS has rules about data sharing, the information is not going to be funneled into the Allstate application, so you will have to go through it again. So in this case, the name, date of birth, so on and so forth, that's going to be in here. Take an extra 3 seconds, 5 seconds, 10 seconds to verify or get the client's information in. We're just going to enter with that address, mailing address, phone number, mobile, beneficiary for products. The plan enhancer does have a life insurance or a term life component, or AD&D. Billing is going to same as normal, bank draft, so on and so forth, payment method. And then lastly, we have a new signature method that's called text PIN code. With text PIN code, you're simply going to send for the Allstate products, send a text message to your client on their lock screen. Even they will be able to, if they have push notifications on their lock screen, they potentially will see that 6-digit code on their lock screen. All they have to do is read that back to you, and that will serve as signature for the Allstate application. So it'll still bring back the summary of your total here. This is going to be the plan enhancer, so your monthly supplemental total to Allstate, and then summarize what your on exchange plan is. So you might be saying, well, Andy, if I already write supplemental with Allstate, why do I'm already using Health Sherpa, I'm already using Allstate to write supplemental. Why do this? One, the single shopping cart experience. Two, the data feeds right into Health Sherpa and comes back to Allstate. So, we talk to agents all the time that say, you know what, I just don't have time in enrollment to do supplemental plans. This gives you the option to do that. It'll take you an extra 5 minutes. An extra 5 minutes can earn you an extra $150 to $500 per ACA sale. Also, in addition to that, it allows you to provide that single shopping cart price point experience to, again, be that consultant, provide your clients with that right of refusal. And even if your conversion rate is 15%, you've earned just that much more on those ACA plans, and you've provided a solution where your clients are more satisfied. More satisfied clients stay with you longer, give you referrals, reduces your cost per acquisition, and ultimately you make more in the process. Well, Andy, I normally go talk to my clients about supplemental in the spring. I hear that a lot, and 90% of agents that I talk to never get back to it because, quite frankly, they're just busy. And so they miss an opportunity to do everything all in one spot. Now, if you're looking at it from a standpoint of saying, okay, well, now where do I go for the ACA plan? So we go back into Health Sherpa, and you'll find that any client that you create, if you don't have the export import in, you won't see any of those clients, but you'll see new clients that you create in this client field here. Binder payments, same as you would normally use Health Sherpa. Everything is the same again. The only difference is it's the white label version for Allstate to be able to connect with our system. We've done a couple trainings on this as well. This is our team resource page. I'll have Taylor send this out to everybody post-presentation. But on this team resource page, there is a detailed overview and more of a demonstration of the Health Sherpa application. Health Sherpa actually partnered with us on this. There's export, import, FAQs to make sure that if you do export your information, import it, that you do it correctly. Also, there is going to be information about our Elevate Rewards program that can give you points to redeem for gift cards and goods, so on and so forth, product information. Our YouTube channel can be linked to from here as well. So to wrap up, and Taylor, if I'm back onto the PowerPoint, I'm just going to get a couple more minutes here.
Yep, you are good.
Perfect. So to wrap up, as it pertains to anything Health Sherpa related, Health Sherpa is dedicated to support you on the Health Sherpa side. If you have questions about how to export, import, you can contact Health Sherpa on that. In the upper right corner, where you can look at it from a standpoint of the existing Sherpa account that you have, or even the new Sherpa account, the white label, there's a question bar, a button at the top that will take you to a place where you can type in your question, and all sorts of articles with Health Sherpa will open up. If you have your smartphones ready, if you want to take a snapshot, you can save the time that it takes for Taylor to get you that link. You can scan this QR code, and it will take you to our team resource page here at Allstate to connect with us on anything Allstate Health Solutions available. Talk to our team, myself or Sherry Blackwood on the Under 65 World, to talk about some of those different solutions or help you navigate the flow of the quoting and enrollment from Allstate to Sherpa as it becomes online to you here in the coming weeks. Lastly, we have a bonus that is going to be launched here any day, but it is already in force. So if you do utilize this program or just sell Allstate Supplemental standalone, doesn't matter if it's through Sherpa or not. There is a bonus, and it's tiered based upon the amount of policies that you sell, and we are weighting it toward ACH payments. Quite frankly, ACH just is stickier, so based upon the amount of policies you write, you can earn anywhere from $10 to $60 on top of the commissions that you make with the supplemental plans. So if there's no other questions, I wanted to say thank you to Taylor for having me, and hopefully this is a springboard for the rest of the day, so that way you can think, okay, well, you know what, how can I fit Allstate into carrier X or carrier Y, carrier Z as it pertains to my ACA clients? And the idea here, guys, is just to provide better coverage, be better solutions, and be better agents and earn more in the process. So With that, I'll turn it back to Taylor, and if there's any questions, I'll be happy to address.
Awesome. Thank you, Andy. I think the only question that I'm seeing here that we didn't have was how do they download that white label?
Good question. So the white label will be available to all of our contracted agents. So if you're already contracted with us through Western Marketing, once it becomes available, once we have that final CMS stamp of approval here in the next week or so, then we will be sending out communication with instructions on how to set up that white label. And from there, once you go to that white label, there'll be a link for you. There'll be the sample email address for you to type in. And then once you're in there, you'll have to click on Forgot My Password. Just create a new password for you, and then off you go. And then you can always connect with us. We'll be doing more trainings here on the Health Sherpa side of things as the next couple weeks unfold before November 1st.
Perfect. Well, I think that was it. So thank you so much, Andy.
All right, Taylor. Thank you. I appreciate it once again.
Not a problem. All right. Well, our next presenter will be Mr. Thomas Finoglio with Aetna. Thomas, are you ready to go?
Yep, I'm here.
Perfect. I'm passing control over to you.
Perfect. Let me get all set up really quickly. Perfect. You just want to confirm that you can see my slides?
Yep, you are good to go, sir.
Awesome. Well, thank you so much. And thank you guys for joining and having me today. Like mentioned, my name is Tom Finoglio. I am the broker manager for Aetna CVS Health, our individual and family plans. I primarily cover Georgia and North Carolina, but today just kind of want to give a little bit more of a national footprint overview. So covering a lot of the states that we're kind of expanding into, but primarily just kind of the rundown of our top 7 states. Today we'll be going over Arizona, Florida, Georgia, Kansas, North Carolina, Texas, and Virginia. So a little bit of a rundown here. You can see of what we're going to cover. This kind of first module or first section, we'll start with why choose Aetna CVS Health. We'll jump into the kind of plan year 2025 information and kind of an overview of the states I mentioned. And then lastly, kind of want to touch on some renewal information just to help you guys and give you the tools and resources that are available to make the renewal process very easy for you during OEP. So let's jump into it. So why choose Aetna CVS Health? So we recognize that members have many choices when enrolling in a benefit plan. The first module here that we're going to go over shows you the value that Aetna CVS Health brings to both members and brokers. In this section, we'll be talking about several services that are available to our members and the tools and resources that we've made available for you. So since the merger of our 2 organizations in 2018, Aetna CVS Health has been continuously focused on making healthcare easier to use and less expensive for our members. We take pride in offering a unique blend of access to the quality Aetna network of doctors, specialists, and hospitals that the clients know and trust, plus the extra value from the neighborhood CVS, all at an affordable price. And we strive daily to make working with us as simple as possible. So at Aetna CVS Health, we're proud to offer a unique blend of physical and digital assets. The offerings we provide allow our members to feel confident they're being supported during every step of their health journey. One of those services we provide is our Minute Clinic. So Minute Clinic is one example of the benefit of combining the care of Aetna with the convenience of CVS. Minute Clinics are located in over 900 CVS pharmacy store locations across the country. And the Minute Clinic, if you're not familiar, it is the largest provider of retail healthcare in the United States. It's got 24/7 access to virtual care and convenient access to in-person care, have allowed our providers to see over 18 million patients while maintaining a 95% satisfactory score. When visiting Minute Clinic locations, members can feel confident that they're being seen in a timely fashion with wait times that are less than the average ER or PCP visit. And as I mentioned, don't forget one of the big key features, our Minute Clinic benefit provides members with access even when they're traveling outside of their service area. So this means that the clients can find convenient quality care no matter where they are. Here's a little bit more about the Minute Clinic. So on-site providers can assist members with over 125 services in our Minute Clinic locations. You can see here in the slide, it shows some of the more common services covered, including treatment for regular bumps and bruises, physicals before kids go back to school, and getting vaccinations. And just a reminder again, that Minute Clinic is a nationwide network, so members can receive Minute Clinic benefits outside of their service area. And whether they're on vacation or traveling, wherever they may be, they can locate a Minute Clinic nationwide. So virtual care and telehealth are kind of two words that are often used interchangeably and have become more prominent over the last several years. However, virtual care has been around for over a decade, and Aetna CVS Health has been at the forefront of that. Our CVS Health virtual care offerings provide 24/7 access to telehealth trained medical providers by phone, mobile, and video for members and families. This solution provides clients with affordable quality care when and where they need it, access to mental health services, and cost-appropriate care options with price transparency. Members can access these services online or on our mobile app, and this offering is complementary to the member's current coverage and is in place to increase access and convenience to this important role of managing care. Virtual care providers also coordinate with in-person care options to ensure that each member is covered holistically. And one of the benefits here, our CVS Health Virtual Care Minute Clinic is a $0 copay for non-HSA members, and a deductible applies for members who are enrolled in a high deductible health plan. Here's another program and service we've had. We started it last year in 2024, but it's another exciting member offering in our portfolio. It is the Aetna Over-the-Counter Health Solutions, or the OTCHS benefit. This is a value-added feature focused on health and wellness. It provides members with up to $25 per quarter, up to $100 a year, and this allowance can be used on hundreds of CVS Health brand products, such as cold medicine, pain relief, and more. The allowance is simple to use and can be redeemed in-store, online, or over the phone. And it's not like those, typical rewards programs where they have to, do a health assessment or, sign up. It's automatic. They get the $25 per quarter automatically. All they have to do is enroll in an Aetna CVS Health plan. Another example of the commitment we have to combining care and convenience for our members is the 20% savings program. This 20% savings can be found on their ID card. When an Aetna CVS Health member receives their 2025 ID card, they'll find a barcode on the back of it. You can see here in the picture on the slide, and that barcode allows them to access 20% savings on all CVS Health brand health and wellness items. Members can shop, eligible items online at cvs.com or when shopping at a retail store. And redeeming the in-store credit is easy. It's as simple as showing the associate at checkout their ID card or providing their name and birth date so the associate can look them up. So another great opportunity and service available for our members. New for 2025 in some of our markets is the addition of adult dental and vision in some of our plans. This benefit will provide eligible members with coverage for preventive, basic, and major dental services. They will also receive vision coverage featuring low exam copays and $150 annual allowance towards frames and lenses. Members will be able to clearly see which medical plans include the dental and vision coverage during open enrollment, and it'll be based on the plan name. So we will have the adult dental and vision listed in the plan name, so it's easy for them to identify which plans includes this benefit. And members can call customer service on the number of their back ID card if they have any questions, help finding a provider, or for other questions that they may have about these benefits. So the Aetna Health app and website also encourage clients to play a more active role in managing their health and benefits. The website and app access is available as soon as the members receive their ID card. Members can also access their ID cards digitally, and they can even download it to their mobile wallet. One important feature of the Aetna Health functionality allows members to view their health plan summary, get details about coverage, search for in-network providers nearby, track spending and progress towards deductibles, out-of-pockets, etc., and then manage and submit claims. Members have access to their benefits anytime, anywhere, and English and Spanish versions are available for the app and website. So through our website and Aetna Health app, we bring together the things that matter most to members' health. This includes personalized experiences, benefit and care options, and guidance tailored to their health needs and goals. A core component of the Aetna Health app is the accessibility it affords our members. Using these tools, the members can pay their premium and set up auto pay. They can search for virtual care providers and schedule an appointment. They can get cost estimates for procedures and price out medication, manage prescriptions, request refills, find in-network providers, update any account preferences, an effective more communication, and they can also use a chat feature to get their questions answered. So those are some of the member resources and services that we provide. This next section we're going to cover is some of the resources that we have available for our brokers and agents to kind of help you manage your book of business and serve your clients. So the first one we have is Producer World, and our Producer World website is your go-to site for information, tools, reports to support your clients. You can use it to learn about products, view marketing materials, leverage tools to support your sales, and much more. Some of the useful things you'll find on Producer World include a variety of marketing, sales, and educational materials for your members, broker assets like benefit grids and service area maps. We've also got ready to sell status and guidelines for onboarding and assigning commissions. And then we have access to our quote and enroll tool and much, much more. Accessing Producer World is really easy. You can, use the link you can find on Aetna.com and access it there. I've just mentioned it, but our quote and enroll tool, as we just touched on, is a valuable resource for you that can be used to managing your book of business. It is embedded within Producer World, and it provides you with a variety of tools to help you manage and service your clients. Within this tool, you can see here on the slide, but you can view high-level information on premium, membership, applications, and completed quotes. You can also search by members by name, issuer ID, or exchange assigned ID. You can view their invoices, coverage details, payment history, any kind of renewal notices or enrollment confirmation notices that they receive from CMS. All of those are housed within our quote enrollment tool. So it's a great tool that allows you to help your members renew, submit new quotes, and view all the quotes that have been submitted or saved. So a great feature for you. Launched last year, our IFP Marketing Studio is a self-service tool that offers a variety of Aetna CVS health marketing materials for our broker partners to customize and use at events during open enrollment. It is an on-demand portal available 24/7, so you can order Aetna CVS health branded printed materials, promotional items, and digital assets wherever you would like. Here are some of the items you can see on this slide. So you can see here it's got a variety of flyers, brochures, branded mail and email templates. It's got social ads that can be used for social media channels and promotional items including pins, bags, Post-it notes, chip clips. All of those are available for purchase. So when searching in the IFP Marketing Studio, you can filter by brand, state, or language. So you're only viewing what's relevant for your market and your members. And then customizing is very easy. When placing an order, you can add your name, phone number, email address, and much more. The material you selected will show up in real time on the page, so you can see exactly what your items will look like when they're delivered. And then our marketing team is always looking for new assets to be added to the site, so be sure to check back periodically, especially during open enrollment. So here I wanted to provide some contact information for you. So whether you have questions on getting licensed or you're running to an issue, assigning commissions, or any other resources on Producer World, you can just give us a call here or use any of the email addresses. And this is a great tool for you to, take a screenshot of or take a picture of for any kind of help and assistance you needed. So let's jump into our 2025 footprint. So as you can see here, in 2025, Aetna CVS Health will be offering coverage in 17 states. And this map here kind of shows you the markets that are being unchanged or remain unchanged for 2024, and which states we've expanded into for 2025. So you can see here, 2024, our current county mark is at 475. We're expanding into 146 new counties, giving us a total 621 counties served in 2025. And as I mentioned, we've got all of our service area maps and a lot of our 2025 marketing materials already on Producer World. So I'll just kind of go through some of our top 7 states. And most of those are expansion states. So we want to give you a little high level overview of, where the expansion is for 2025. So we'll start with Arizona. You can see here the service area map of Arizona. There's no expansion in Arizona, but still wanted to provide, you can see over here about over 3,800 PCPs and specialists, or PCPs, 26,000 specialists, 46 hospitals, 180 urgent care centers, and 31 Minute Clinic locations. So this is our service area for Arizona in 2025. In Florida, you can see all the counties that we cover here. It's got over, just at about 11,000 PCPs, 72,000 specialists, 226 hospitals, 688 urgent care centers, and 83 Minute Clinic locations. We do have expansion counties in Florida this year for 2025, so I do want to run through those really quickly. New for 2025 is the Pensacola area. And you can see here on the map, it's going to be Escambia and Santa Rosa County. And you can see the participating hospitals here. Another new area is Tallahassee. You can see all the new counties that we will be entering for 2025, and then all of the participating hospitals. And just with the interest of time, I want to run through these a little bit quickly, but as I mentioned, these are available on Producer World. So if you miss it, it is available there for you. We've got a new county, Polk County, in the Tampa market. So you can see the new markets there, and of course, all of the participating hospitals remain the same. And then a few more markets, or a few more counties in South Florida. You can see Glades, Highlands, Monroe, and Okeechobee. And then the HSA or HCA, Marinas, Henry, Lower Keys, and Fisherman's Hospital are participating in network. We'll move on to Georgia. You can see here about 5,500 plus PCPs are available in the market. Over 37,000 specialists, 85 hospitals, 280 urgent care centers, and 28 Minute Clinic locations. You can see here on the map, we cover about the greater Atlanta market, kind of all the way down through Athens, all the way to Augusta, and then down the coast all the way to Savannah. And then you can see over there in the bottom portion in the Albany area, those are our markets. So no expansions for 2025 in the Georgia area, but you can see the market and all the counties listed. So here's Kansas, an overview of Kansas. We've got about 4,300 PCPs, 24,000 specialists, 142 hospitals, and 9 Minute Clinic locations. We do have some expansion in the Kansas area, so I want to run through that really quickly. You can see here in the Topeka area, we have 1 new county and Marshall, and you can see the Stormont Vale and KU St. Francis hospitals are participating in network. The Manhattan service area is kind of new for 2025, and you can see all the counties here listed, and the participating hospital is Stormont Vale. Another new area we're entering in for Kansas is the kind of Northwest Kansas market. You can see here all the counties listed, and then KU Great Bend and Hayes Medical Center are the participating hospitals. I do want to note this is an EPO, so primary care and specialist referrals are not needed. Another new EPO is the Southwest Kansas area. You can see all the counties listed above to the left, and then Centura Health is going to be the participating hospital. Lastly, down on the south, we've got Pittsburgh, and you can see all the new counties that we're entering, and then Gilroy Medical, Neosho, and Labette Health are the participating hospitals. So next we'll jump into North Carolina. You can see here about 7,800 PCPs in the market, 49,000 plus specialists, 88 hospitals, 225 urgent care centers, and 52 minute clinic locations in the statewide. I do want to say that this is also another state that has state reciprocity, so members can go to any in-network provider across the state of North Carolina. We do have we are entering in new one county for 2025, and that is Catawba County in the Asheville market. You can see here just the participating health hospitals include Mission, Advent, Catawba Valley Medical, Fry Regional, and Pardee Hospitals. So that is a look at the only new change we have for North Carolina 2025 is the addition of Catawba County. We'll jump into Texas. So there's 7,400 plus PCPs in the network, 61,000 plus specialists, 136 hospitals, and 542 urgent care centers. We do have some expansions in the market of Texas as well, so we'll run through those really quickly. The Uvalde Greater San Antonio area is a new market for 2025, so you can see the expansion here. Canali Memorial, Medina Regional, Uvalde Memorial, DeMint Regional, and Frio Regional Hospital are the participating hospital networks. McAllen is another new market we are entering down on the southern tip of Texas. You can see the two counties we're entering, and DHR Health is the participating hospital. Few new counties we're entering in the Midland Odessa area. You can see Borden, Dawson, and Gaines. And of course, the Medical Center of Midland Memorial and Critical Access Facilities are still the participating hospitals that I wanted to call out here. And then lastly of our states I wanted to touch on is kind of our Virginia market. So you can see here in kind of the southern Virginia is a little bit unique where it's kind of broken up into kind of a southern and northern Virginia. Southern Virginia has about 2,000 plus PCPs, 19,000 plus specialists, 24 hospitals, 14 minute clinic locations you can see here. And these are all the counties. And then for the northern part of Virginia, we partner with Innovation Health. And so they've got about, you can see here kind of the markets that they're in the northern tip of Virginia. So that was a quick run through of our kind of our service areas and some of the expansions that I wanted to touch on for 2025. Now we'll quickly go through some kind of plan overview. So, a lot of our plans will have the $0 CVS Health virtual care, the $0 minute clinic visits, and it's, like I mentioned, it is a national market, so they have access to all the national markets. We do have the OTC allowance program that I went through and the 20% off. We will have a $25 cap for preferred insulin. We will have added standard coverage services, the IUI and AI for basic infertility. And then included on select plans, you can see over here on the right, we have adult dental and vision. And then all of our Aetna plans include an enhanced RX benefit for low-cost generics, except those do not apply for our CMS standard plans. Just wanted to point out a few highlighted plans that we, are very attractive and very popular amongst our plan designs. This first one is our Silver 5 Advanced. It is in the 94% cost share reduction variation, but this is a very, very rich and attractive plan for members who do qualify for those Silver CSRs. This is a great plan. You can see here, $0 deductible, pretty much zeros across the board. Low specialist copays, a $5 urgent care copay. So this is a great plan if you've got members that qualify for subsidies and in the cost share reductions, the Silver 5 Advanced HMO plan is a great opportunity for them. And as I mentioned, plan grids, service area maps, those are all available on Producer World. So just wanted to go highlight really quickly some of our plans. Another good plan that we offer is the Bronze 4. It's got a $0 medical deductible, $4,995 RX deductible for the prescription drugs, but a 0 PCP copay, $85 specialist copay. So this is a great plan for members that do not qualify for the cost share reductions, but still want, kind of those low utilizers. They want a lower premium. This plan offers a great benefit for them of, $0 medical deductible. If they don't have any prescriptions, they don't have to worry about the RX deductible too much, but it is a great option for those members that like the bronze plans. So next, let's just kind of, as we wrap up, I just wanted to point on a few items related to renewals. We recognize the important role that, agents and brokers play providing support for members during the renewal process. In this module, we'll show you kind of what's focused on, what's included in our renewal guide to assist both you and the members to have a smooth renewal process during this open enrollment. So, even when a member auto renews, they're seeking stability when they renew their health plan. You play a key role in helping members during this time, and our goal is to provide you with tools to help your clients renew for 2025. And this includes our 2025 Broker Renewal Guide. The Broker Renewal Guide provides insights on the tools and reports you'll find in Producer World to best manage your accounts during renewals. It also provides helpful resources on the ways your clients can pay their premium, including setting up auto pay. And additionally, you'll be better able to assist your members in finding their plan needs and setting up their communication preferences, including email, SMS permissions, and language preferences. And if you're looking for a specific Aetna CVS Health contact or provides a link to your clients, allows them to request an ID card, the renewal guide has all of that information in there, so it makes the renewal process seamless and easy for you. We'll touch on some member communications. During this part, we know how important member communication is, especially during the renewal season. You can see here on this slide, it shows you what your current Aetna CVS Health clients can expect to receive through the end of 2024 and into 2025. So renewal emails will begin in mid-October and they will continue into November. These are those CMS auto renewal messaging that includes information on their 2025 plan benefits. All renewing subscribers will receive a countdown to coverage direct mail and email in late November, which will educate them on what to expect before their plan begins. So we're also happy to share that 2025 ID cards will be mailed starting in mid-November timeframe, which is earlier than we've sent them in prior years. The feedback we receive during open enrollment and kind of pre-open enrollment is members like to have their ID cards as fast as possible. So we're delivering those in mid-November and starting to send those out mid-November so they have them before their plan begins. And shortly after 2025 benefits go live, members can expect to receive several welcome communications. These will focus on getting them more comfortable with their plan, along with the tools and resources that we provide and that we've kind of gone over today. So just closing up, that is now the end of kind of the training we have. Just a quick recap, Aetna CVS Health is proud to offer a robust set of tools and resources that support both you and your clients during open enrollment. We will continue to offer a strong national footprint in 2025, along with service areas and plan offerings that reach clients across your market. If you have any questions or need more information about anything found in the presentation, reach out to me or any kind of designated broker manager in your markets. Will be happy to assist. So a few minutes left, but thank you for your time today. Greatly appreciate all the support you provide your clients and the partnership you have with Aetna CVS Health, and look forward to working with you this open enrollment and wishing you guys a very successful OEP. So thank you for the time today and have a great one.
Yep, thank you, Tom. Doesn't look like we have any questions, so I think we are good to go to move on to Gene. with Molina. Gene, are you ready to go?
Yeah, I'm just looking to be able to share my screen here. Okay.
Yep. I'm passing it over to you now.
All right. Okay, let me get this set up here. All right, can you see my screen?
Yep, perfect. We can see it.
Very good. All right. Hey, like I said, my name is Gene Wedgeworth. I'm a marketplace sales manager with Molina Healthcare. And yeah, just wanted to kind of go over what we've got going on this year for the open enrollment in the states that we're in. So just to get going here, I'm sure all of you know, these are the enrollment periods. I mean, CMS, you can see most of the states that are in the CMS start November 1st through January 15th. A couple of differences in, California extends it a couple of more weeks until the end of January, and then Idaho has pretty much done their own thing with October 15th through December 15th. So just a little bit variances. I'm sure you all know about it. Just a background on Molina. We are a Fortune 500 company, number 125 in that category. One of the things about Molina is we're in all of the individual markets, Medicare, Medicaid, and of course, Marketplace. As of the end of March this year, we're at a little over 5.7 million members, and that's through 21 states. Now, the Marketplace is not in 21 states, but that's all three categories. And the reason Molina was developed was years ago, back in 1980, just to serve those people in the underserved market that really had no access to healthcare, that they wanted to make it available to everyone. You can see the national footprint here. Like I said, the Marketplace is in 15 states. You can see we're expanding in about 4 different states, which we'll go over in just a couple of minutes, but these are all the states that we're in and all the counties that we're in those states that we're participating in. And I just mentioned the states with expansion. Starting up number 1, Florida, which is one of our stronger states. You can see up in the Jacksonville area, up in the up north, a couple of different states we're expanding in. We should be fairly competitive in Jacksonville, Orlando, kind of in the middle of the state, St. Petersburg, Tampa, a couple more counties there, very competitive in those areas. And down in South Florida, adding another county, but I will tell you, we're very competitive, going to be very competitive in the southern part, Miami-Dade County. One of the biggest things to point out in Florida this year is there are no referrals needed to go to a specialist. Previously, you had to get a referral from your PCP. That has gone away this year. So a huge, huge benefit for members in Florida. Kentucky, kind of one of the untapped states. We're expanding in just 3 counties there, just to enhance the network and area. I will say Kentucky's kind of one of those untapped states. Not a whole lot of brokers are there in Kentucky that we work with. So, if that's something that you're licensed in, could be a really good area for us. Ohio, you can see we're expanding in several counties in Ohio, 15 exactly. Just about covered the whole state, but there's a few counties that we're not in, but for the majority we're in. One of the big things about Ohio is this year we are opening up a bronze plan. So first time bronze plan, the only county which you can see here that's pointed out Columbus, Franklin County. For some reason, the state will not allow a bronze plan in that county, but for the rest of the state, we're good there. So great selling situation there, and we're going to be very competitive. Texas, another expansion. In the North Texas area, we had the core 4 counties there. What we found is a lot of the people leaving the highly populated counties to the more rural counties. So the need to expand in some of those other areas has been great. And to be honest, I'm in Texas, I'm in North Texas. The past couple of years, we have not been very competitive there, but this year is going to be different. And I can tell you, Texas this year is going to be a major gold plan pricing play. So don't leave out the gold plans when you're looking at Texas. It's going to be a major play. Also down in the valley, very competitive, highly Hispanic population, which we meet in very well with. Webb, Star, and Hidalgo County down here that you can see, we've been competitive. We're going to be very competitive again this year, plus with the expansion counties. Out in El Paso, we're in the mix, but the good thing about El Paso, and we'll talk about New Mexico too, but we do allow members to go back and forth from Las Cruces, New Mexico to El Paso to access the networks back and forth. They're only about 30 minutes apart if you know this part of the state in New Mexico. Members like to go back and forth, so we allow that. So not an issue there. Okay, so those are the expansion states, the states without expansion. California, I will say, and you'll see a county overview in just a second, but Los Angeles, San Diego, all of this area down south, for the most part, there's a couple of areas that we're not so competitive, but for the most part, very competitive down there with both pricing and network. Just an example of plan designs. I mean, you'll get these slides, so I'm not going to go over all the different benefits here, but just an example of the plans that we have in California. And like I mentioned, the counties in San Diego, lowest cost silver, gold, platinum, and bronze. Second lowest silver, gold, platinum, and bronze in West Los Angeles. Lowest cost gold and platinum in San Bernardino and Riverside. A little bit better pricing in Orange County and Imperial, the lowest cost silver, gold, and that you can see where we have definitely an advantage in most of the region down there. So very good situation in there. Idaho, you can see we're kind of spread out, but it's because of the population. We're in the most populated areas. To be honest with you, I think Idaho is kind of status quo this year. We're going to be good in Boise, but the rest of the areas, I mean, we're there. We're going to be in the mix, but I wouldn't say we're going to be like the lowest price, but we're there and in the mix. But one of the good things is you can see, as far as pricing is concerned, we're actually taking a negative this year to try to get back in the mix. So we should be there. And you can see the major provider groups here. Like I say, you'll get all these slides that has all this information, but you can see as far as where we're at in the most populated areas, we do have the network there to maintain everything. So we're in good shape there. Illinois is one of those places. Chicago is basically Cook County is where we are concentrated. And obviously because of the population, but we are definitely competitive there. One of the things we found about Chicago is it's a huge city, huge metropolis, but we don't see a lot of broker activity in that area. So if you're licensed there, this is a really good market that you could go after. Michigan, another one of those states that we are in a good situation as far as coverage and pricing. We're in the highest populated areas, very good network, right in the mix as far as pricing. I would say Grand Rapids is probably going to be one of the more competitive areas, but as far as being competitive in the market and being where we need to be, we're right there with everyone else. Okay, Mississippi. Mississippi and New Mexico are two of the states that we have every county in the state. Mississippi is kind of a sleeper state for most people. A lot of people don't go after the business there. We have very few resident agencies that we're contracted with, so a lot of outside agencies do business there. In Jackson and Biloxi down south, you can see on the coastal area, very competitive, very good network. We added, if you're familiar with Mississippi, St. Dominic Hospital, which is a huge hospital system. Also down south, the Ochsner clinics and facilities. So great advantage as far as network, pricing, everything is good there. If you're licensed in Mississippi, like I said, it's kind of a sleeper this year. We're going to be in very good situation with pricing. And we have a bronze plan there. Bronze in Mississippi, Florida, and now Ohio, except for Franklin County. And like I just mentioned, New Mexico. New Mexico is another one of those states that we've been right in the mix. Centene or Ambetter pulled out of the network or pulled out of the state this year. So that only leaves 4 carriers. And the past couple of years, we've been in the number 1, 2, or 3 slot in all counties, pretty much all counties. With the exit of Ambetter, we're going to be in a very good situation there. So New Mexico, but I will say, if you're licensed in New Mexico, great. If you're not, they do have a state-based exchange, Be Well New Mexico. You basically have to be either a resident agent or you have to have an MGA that has a presence there already to get licensed there. They're very protective of their resident agents. But one of the other things I mentioned earlier with Texas is down here in Las Cruces, you can go over to El Paso to get care, or your members can. So it's a very good situation. Nevada, we just went into Nevada last year. I would say we're in a development stage there. We're in the Reno and Las Vegas markets, but to be honest, we're not the most competitive there. But we are there, and I think this year's going to be a little bit better pricing wise and network wise than last year. But it's also another one of those state-based exchanges to where you have to be either a resident agent or have an MGA that is contracted. Now, South Carolina, we're basically in the entire state except for 1 county. We are very competitive there. You can see all the different counties that we're in. South Carolina is one of those states that we've always been in the mix. We have a fantastic network. You can see all the counties that we're in, which is 45 counties total. I mean, it's just one of those states that we've always been competitive. We're still competitive. We have a great network. And if you're licensed there, fantastic opportunity to do business. Utah is kind of like Idaho. We're spread out because of all the rural areas, but we're in the most populated areas. I would say Salt Lake, yes, we're in a very competitive situation, but St. George down in the south is probably your best bet if you're going to do business in Utah with Molina because of the network situation and the pricing situation. And you can see just based off of pricing, I mentioned 4.9%, and you can see what everyone else is doing. So we should be in a good situation there as far as being in the mix for the plans and the pricing. And we do have the 4 top hospital situations there too. So you can see Intermountain, Mountain Star, Stewart, and University of Utah. So good situation there. Washington is another state-based exchange. They're not quite as limited as far as getting contracted there, We've highlighted the 4 areas that we're really good in. I will say this is another state, kind of a sleeper, that broker control is about 30% there, based on the average of 50 to 60 in all the other states. So it's wide open for agents to go in and try to help members out and help, instead of members just going directly themselves. So very good situation there. If you're licensed in Washington, it's pretty wide open for agents to go in and do business. And you can see also, as far as the increase, as pricing, we're not the lowest, but we're on the low end. You can see some of these other carriers are doing way double-digit increases. So we should be in a very good pricing situation as far as that's concerned. And the network, and like I said, you'll get these slides, but this just shows we have a very good network in the areas that we're in Washington. One of the things that the state-based exchange does, and I won't get into details, but they basically take information from all members when they enroll to see where they fit, as far as their background and history, and they try to tailor the state plans to meet what their makeup is as far as enrollment. And last but not least, Wisconsin. Wisconsin is one of those that, we're in the mix. We're not the cheapest, we're not the most expensive, but we're in the most highly populated counties, 29 of them. And, as far as network, everything is concerned, we're in good shape there. But, we've got some really good plans, just like all the other states. But I would say that this is one of those that, we're definitely there. We're a presence. We've got a good population there. And, like I said, we're not going to be the least expensive, but we're not the most expensive. So we're still in a good situation. Okay, now moving on to member resources. What we've done is, which used to be my health perks, is now my Molina Healthy Rewards program. Great program for all members 18 and over. It is a wellness program that all the members have to do is fill out a health assessment or a wellness assessment, and then go into their primary care physician and get their yearly checkup. And they'll be eligible for up to $200 in gift card incentives. Great program. It covers smoking, high blood pressure, diabetes, asthma, depression, and just an overall healthy living atmosphere for the members. And like I say, it's free, available to all 18 and over members, and up to $200. Something else that's included, RX savings solutions. It's just a free benefit to help cut down out-of-pocket expenses for prescriptions. All the members get it. They'll get an email with all the details to enroll, to walk them through the program, show them how it works, and all the contact information. If they don't have email, they can call the 800 number here. That'll be in their enrollment packet. They can pull it up on the app. You can see on the phone there. So it's just a nice free added benefit. Okay, and just an example, you saw QR codes from one of the previous presentations. We have QR codes that we've developed for everything now. If you want to do the mobile app, here's the QR code, the member e-portal, number of things that you can look up on all these. Go on your app, find a doctor, request an ID card. You can pull up your ID card, digital ID card that you can show the doctor and use it right off your phone. So a number of things they can do, and this is just touching on just a few of them, but there's quite a few more. Okay, something we did over the previous years is previously we had one member services number. And what we realized is the wait times, and it was just ridiculous. So we came out with a dedicated number for each state to be able to go on to. And the people answering phones are familiar with that state. So you're not getting someone that's, from California that's answering the phone in Wisconsin. So it's just a nice way to make it a little more user-friendly for all the members. All right, now as far as payment options, you can see the auto pay, online bill, phone, mail, all these options we've had forever, but one of the new benefits that we have this year is the check-free pay. Check-free pay is an option where someone can go in person and make a cash payment option to pay their premium. There's over 30,000 locations. You can look it up down here you can just put in check-free pay and look for locations, but basically all they need to do is submit their bill stub or their subscriber ID, and they can make a payment right there in person, and it's processed through Fiserv, so it's immediate. Just like the member services, enrollment and premium billing numbers, we do have a dedicated number for each state that will have a person that's dedicated to that state to answer the phones and help them. It just takes the hold times way off and makes it a lot more user-friendly. As far as benefits, we talked about Teladoc. One of the big pluses this year to Teladoc is we are including mental health services on that also. So previously it was not there available. It is this year. So big plus there. And of course, under our value basics portfolio, preventive screenings, preventive prescriptions, pediatric vision, the RX savings that we talked about, and for minor things, the nurse advice line. And we talked about the healthy rewards, but those are free benefits that are included. This is just basically a cheat sheet for all of our states. I'm sure most of you are licensed in multiple states. So this is just a nice little cheat sheet that when you're talking to folks on the phone or actually in person, whatever, it just shows what plans we have available in each state. So it goes through all of our portfolio. And just to kind of break down, like I said, Florida, Mississippi, Ohio all have bronze plans. Those are the 3 states that we have, excluding Franklin County and Ohio. But this is a breakdown of pretty much the bronze plans that we have. Silver, which is the more popular plans for us. The Silver one is kind of a buy-up program, but I will say the low-cost Silver 12 plan has become one of our more popular plans because the first 4 PCP visits are free. They don't have to be for preventive. It's just the first 4 visits are free. So a lot of people have gone to that plan just for that fact, because they can go to 4 visits free. And of course, the gold plans, like I said, I will say out of all the states, it shows the gold 12 in Texas. It's a new plan. Gold is going to be the play for Texas this year from what I've seen on pricing. So if you do business in Texas, do not exclude gold when you're looking at plans. Okay, and just to follow up with the Teladoc, we've already talked about it. It's 24/7, 365 days a year. You can see some of the minor things. This is just touching base. There's a ton of things that they can do. I've used Teladoc several times myself. Great service. You get a licensed physician on the phone, and depending on your situation, they can prescribe medication over the phone. And also the mental health that I mentioned is definitely included this year. For adults that want vision, the Silver 1 and Gold 1 plans include adult vision through VSP. You get 1 calendar visit each year, or 1 year exam each calendar year, and $150 benefit towards lenses. One thing we just included this year, we've never done before, but in Texas, we do have an off exchange plan. That's basically for folks that do not qualify for a subsidy through the ACA. They can purchase basically all the plans you'll see on the next couple of slides. They pretty much mirror all the on-exchange plans, but they are a little bit less expensive. So the reason for that is off-exchange, you don't have to pay the fees to be on exchange. So it's a little bit less expensive. So for those folks that can't qualify, that want to get coverage, we do have that available in Texas this year. And this just breakdown, I won't stay on this long, but just a breakdown of all the plans, but you can see they pretty much mirror all of the on-exchange plans for the off-exchange. There's a little bit of differences, but not a lot. And you can see more of the silver plans. So pretty much mirror them, but those are the off-exchange. And the good thing is, as far as enrolling, if someone is off-exchange, you can still go to Health Sherpa. All you have to do is click on the off-exchange, and the enrollment is exactly the same, except you don't have to go through all the income questions and things. Okay, provider directory. That's something that we are in an ongoing process, updating, trying to keep everything updated. You see the QR code down here. You can scan that and go right to it on your phone. But basically, you can, do a number of searches to find a physician, a facility within a county, state, zip code, a mile radius. You can even pull up a map and see where they're all located. So very good resource for you and your members. Now, one of the things also, our Molina marketing store that is available this year, and the next couple of slides will show you some of the brochures that we have available. This is just one of our standard brochures that goes over the highlights of some of the benefits that are covered at no cost. A few more others here. One good thing that we've started this year, and if you go on the Molina marketing store, if you decide you want a brochure or a flyer, the first 50 copies are free. After that, there's a little bit of charge, but you can get whatever flyer or brochure you want. First 50 are free. And these are just examples. Benefits at a glance. Once again, another example of what we have available on the marketing store. This goes over state by state, and these are in English and Spanish, so it shows you all the benefits that are available in that state. Fact sheets are available also. Nice thing about fact sheets is, yes, we do some highlights over here on each state to kind of show where we're at and the things that are available. But also, if you have a client, it shows by county every hospital that is in that state by county. So, if you're doing a presentation, if you're out with a group or even an individual, if they want to know by county, it's right there at your fingertips. Okay, one other thing on molinamarketplace.com, the provider directory, but if you go down to forms and documents, you can pull up pretty much everything on the plans. Formularies, benefits at a glance guides that we just talked about, member forms, pretty much everything is right there, one-stop shopping for you or your members to go to, take a look and see what they've got. And compare 24 plan to 25 if they're coming off a 24 plan, going to a 25 to make sure that the benefits are what they want. Broker resources, you got the 855 number here. Hours 6 a.m. to 6 p.m. Mountain Time, Monday through Friday. I will say the MP broker support email, fantastic source for you to take care of pretty much everything. I use them on a daily basis. They're great about turnaround on any kind of questions you have or any kind of issues. Just a checklist like you're doing now, the trainings. I will say one thing I want to really stress, go on to your portal, your Evolve portal, and make sure, go under credentials and sales states and make sure that you're set up and certified in every state that you're going to sell in. Because if you are not, If you sell something in a state you're not certified, you won't get paid. So make sure that you're set up. The broker portal, just an easy access to go to your broker portal off molinamarketplace.com. All you have to do is click on there, and you can do a book of business search, request ID cards, or make requests for primary care position change for your members. I'm not going to go over this. This is just required. It's just best practices that I'm sure 100% of you are doing this anyway, but it's just good information to go over in case you want to just reference something. And last but not least, commissions. We are increasing commissions in 7 states, almost half the states that we're in. You can see the increases that are here highlighted in green. So we're just trying to get more competitive in the marketplace. And here's the sales team, QR codes for everyone. I'm over several states. We've got 7 of us across the country. We all work together. So if one of us is not available, the other one is. And like I said, just reach out to any of us if you ever need anything. And mention the QR codes. Here's all the QR codes for everything. All you have to do is take your phone and click on it, and you're good to go. It'll pull it up. So that's it for Molina this year. And just want to thank all of you guys for participating and letting me have the time to share this with you.
Awesome. Well, thank you so much, Gene. Doesn't look like we have any questions, but we'll get that presentation sent out for everybody afterwards. So I think we should be good on that front. Michael, are you ready to go?
Yes, sir.
Perfect. Well, I'm going to go ahead and I'm going to pass over the presenter over to Michael with Ambetter, and he's going to take us into a deep dive of what they have for this upcoming year.
Awesome, awesome. Able to see that okay?
Yep, we can see it.
Pop up? Awesome. Well, thank you guys for taking the time today. Really appreciate the opportunity to talk about Ambetter. My name is Mike Mulcairn. I'm the regional sales manager for the Southeast for Ambetter. That includes, Florida, South Carolina, North Carolina. We're a little directionally challenged. We also include PA, New Jersey, and Delaware. So I guess it's Southeast if you're in Toronto, but that's kind of the territory that I run here for Ambetter. So wanted to give you guys some updates on some plan designs that we think are going to be the most competitive in most of our markets. The deck I'm using today is a little bit Florida centric, but this information is universal. I think if you've sold with us in the past, you've seen that, the plans that we offer in Illinois are the same plans that we offer in North Carolina. So, the Florida deck's a little bit more encompassing, makes it easier for us to kind of get through all the information. So first, if you're not familiar with who we are, and if you are, and you've sold with us in the past, just a little bit about Ambetter as a whole. We're the #1 carrier on the marketplace as far as membership. We're in 28 states nationally. We've added Iowa to our footprint. I think Gene actually just mentioned we did pull out of New Mexico for this year. Really just one of those things, we didn't feel like we were going to be competitive in the future. So we pulled out of there to put our efforts in other states, Iowa being one that's new for us. Pricing looks really good there in Iowa. And I'll talk about some key markets that we think are gonna pop off for us this year, really good opportunities for us to get some membership. Like I mentioned, we're #1 on the marketplace. About 1 in 7 folks that have a plan throughout the country have an Ambetter plan, and that's with us not even being in all 50 states across the country. About 4.3, I think we're creeping up to about 4.5 with some of the special enrollment throughout the year. And the nice thing about all of our plans, and all of our health plans that we have throughout the country, we are a national brand, but we have a local health plan in every state. So, in Florida, it's Sunshine Health. Texas, we have Superior. I mean, all throughout the country, our plans are the same, but the folks that work and facilitate, member services, they are the ones that negotiate provider contracts, they are local to their markets. So I think that's, something key for us. Myself, like I said, I represent a bunch of different states. Our sales team is throughout the country, but the folks that are working with your members on a daily basis do happen to reside in the states that they are located in. And last but not least, we've been on the marketplace since the inception. I think we're going into the 12th open enrollment here for the ACA. We've been a part of all of them. And a little bit about our parent company. So if you're not familiar, Centene Corporation is our parent company. And they also own the state health plans that I mentioned a minute ago. Centene, I always say it's, one of the largest companies a lot of people haven't heard of. We're 22nd on the Fortune 500 list. More than 30 years of experience in the managed care industry. I think you're probably familiar with our Medicare wing, WellCare. We also have a lot of the state Medicaid contracts throughout the country. So Centene, it's great to have that backing, the financials behind Centene that really can help get Ambetter to new heights year over year. So what's new for 2025? And like I mentioned, a little bit of a Florida-centric deck here, but a lot of this is going to be, universal throughout the country. First being our bronze, silver, gold, and what we call the core network. These are kind of our full boat plans. So really any provider that we have in our provider directory is in network with these plans. So, in different states, you may even see them listed as an HMO, but they don't function as an HMO. They're no referrals needed on these plans. I always mention this, I live in the Midwest now. A lot of people that I know tend to be snowbirds. If they have an Ambetter plan that's a premier network plan, they can live in, say, in Illinois, but then they can also use the providers that are in Florida, when they leave town. So we're introducing a condition-specific plan this year for diabetes through the Premier Network. With that plan, it'll be kind of spelled out on the formulary list this year, but we're going to have, some lower copays and some things that are even no cost for, insulin, different diabetic, drugs that folks are going to be taking. So that will be offered in some different states throughout the country. For Florida specifically, we expanded into Martin County. We just released a new Ambetter Health app. We are going into 2025 and we just released an app. So I think we're a little bit behind the times on that, but essentially the app, it's a member-facing app. It is a mobile version of the member portal. They can, check their claims. They can update their PCP, order ID cards. They can download a digital copy of their ID card through the app. I think it's a great tool, and I'm glad we've kind of gotten with the times and finally have one. Something for you as the broker that's new this year is we're going to have the renewal letters that your member receives in their profile in your broker portal. I think, I totally understand this, as an agent, your member calls you, they say, hey, I got this letter from Ambetter. They're telling me that, my plan's rolling over. Is there anything I need to do? And it sometimes can cause confusion. We want you to be able to see as the broker what the member is receiving. So that will be available in your broker portal this year. In Florida, we're going to use the Ambetter Health national brand and discontinue the Sunshine Health branding. You're going to see this through a lot of our states. So, historically, you've seen in Florida, for example, Ambetter from Sunshine Health. Sunshine Health is the health plan in Florida. We're going to change that to just Ambetter Health. I think this will help. We've had some issues with the provider side of confusion. Sunshine Health is also what our Medicaid product in the state is called. So sometimes it can kind of cause confusion. We're going to go to this more national centric branding here of Ambetter Health. So I think that should clear up some confusion there on the provider side. I mentioned that we're changing the name of the core network to the Premier Network. Nothing for members to do. If they have a plan today that they like and they're in a core plan, it's just going to auto renew. The plans are not changing. It's just the name of what we're calling the network. The one thing that they will need to do in Florida, this is kind of a rule that was instituted this year. Those plans are not going to really have that grace period that you typically see going into January. They will have to make their binder payment prior to the first of the year to keep their coverage. In years past, you've seen us kind of maybe float, and I think other carriers as well, to the end of January. For the Premier Network plans, they are going to have to get that binder payment in prior to 1/1. I would always recommend folks do that anyway. You never know what's going to happen. If you need to use your coverage right away at the first of the year, you want to make sure you have your binder payment in anyway. We're removing virtual access plans and select plans throughout the country. If you're not familiar, virtual access was more of a virtual first plan. I think it's something that was kind of born out of the COVID era. And the select plans were an HMO plan that did not require referrals. It was more just a slimmer network. We're retiring those in most of our states. In Georgia, we are going to keep them just because there's some really strong plans that have strong network partners like Piedmont, Emory, Wellstar, that, I'll mention this here too. Those plans are going to be really competitive in the Atlanta area. Really, we're going to be competitive throughout Georgia as a whole. But we're going to keep those select plans. And again, it is an HMO, but it does not require referrals. Really what it is just a slimmer network than the Premier Network. Here's a county footprint of Florida. If you look here kind of at the way the states are listed, Martin is our expansion. It's in that raspberry color, the Ambetter raspberry. And then the orange highlighted counties are where we have a value portfolio. If you're not familiar, the value portfolio is our true HMO product. It does require referrals. I would say looking at this, the counties that we have, I think, the value is going to be competitive, but I think our Premier Network is probably going to be the lower cost in a lot of these counties. The value plans, they are partnered with really strong network partners, throughout this footprint. I think a good example is in Duval. We're partnered with U.S. Shan for the value network. So really kind of what you're losing there is some of the network partners, but you're also having to do referrals with the value. And again, on the Premier, no need for referrals, anything like that. Just some other broad highlights here of the Florida network. In Broward, we have Broward Health, Holy Cross, Memorial, Hillsborough. We have multiple Advent locations, Tampa General, the Baycare network we added last year. That was a huge kind of boost for our network in the Tampa area. Orlando, we're partnered with Orlando Health. Miami-Dade, we have really strong partnerships, kind of throughout. University of Miami is a part of the Premier Network. Fort Myers, Lee Memorial, Lehigh Regional, Palm Beach, Good Samaritan, JFK, St. Mary's, and then U.S. Shands, like I mentioned, in Jacksonville. I will say for Florida, from a competitive standpoint, Central Florida looks really good. Tampa, Orlando, Jacksonville, Fort Myers area, Tallahassee area looks really strong for us. I think we have some pockets around Gainesville as well. So a really good story to tell for us in Florida this year. Another state I wanted to highlight is just Pennsylvania real quick. The blue counties that you see are expansion for us. Myself, I'm originally from Allegheny County, so it's Pittsburgh, Pennsylvania. We are not quite there yet, but we're in some of the surrounding counties. Pennsylvania, it is a state-based exchange, but I would always highly recommend it. I think as brokers over the years we've seen, I think we're all acutely aware of issues with AOR and, fraudulent enrollments and things like that. The state-based exchanges have done a pretty good job of curtailing that. And obviously, I hope with some of the changes that CMS has made this year, we will see that. We had an AOR lock-in this year. We're looking kind of at what that policy is. That something that we still need now that CMS has put in some stringent policies as well. So more to come. But I did want to call out Pennsylvania. We're around Philadelphia, the Poconos, you get out, Allentown. We should be the lowest cost silver in every single one of these counties you see on your map here. And it's really not going to be, I think there's going to be a pretty big gap there. So we feel really strongly about Pennsylvania. Great network partnerships. In Philadelphia, we have just about every single hospital, including Shriners Hospital for Children. Lucerne County, Lackawanna, we're going to have Geisinger. Jefferson Health is a part of our network. Westmoreland County, which is on more towards the southwestern side of the state, a little bit outside Pittsburgh. Independence Health, that's talking about like Latrobe Hospital, Greensburg Hospital, things like that. Center County, that's where Penn State University, Mount Nittany Medical Center, Cambria, Fayette, we're going to have Penn Highlands, Duke Life Point, and WV, West Virginia University Medicine Uniontown Hospital. So even though it's on the Pennsylvania side, there's a large West Virginia University Medical System hospital in Uniontown. Before I kind of move on, just some of the other states I wanted to highlight. Alabama, really good pricing around Mobile. Delaware, we should be the lowest cost silver across the whole state. Georgia, I mentioned Atlanta. There's a lot of pockets throughout the state where we should be very competitive. Iowa, our brand new state, I think we're going to be, everywhere that we have a plan, we should be the lowest cost silver. Illinois, Chicago, we feel really strongly about, probably going to come in as the lowest cost silver. We just added Advocate, which is, I used to live in Chicago. Advocate's a large hospital system throughout the Chicago land area. Kansas, really statewide, priced really well. Kentucky, another state-based exchange. We should have some really good pricing throughout the state, Louisville, Lexington, Louisiana, in New Orleans, we feel really strongly, and some good hospital networks there. Michigan, really statewide there. I think Grand Rapids might be the only place that we're kind of taking a step back from a price perspective. But Missouri, Nebraska, North Carolina, Nevada, Oklahoma, South Carolina, Tennessee, Texas, Washington. I mean, really all of our states have a good story to tell. Maybe not necessarily in every county, but there's a ton of opportunity in most of the metros kind of throughout the country and some of the surrounding areas. Texas specifically, like Houston, down in the Valley area, like Hidalgo County, we feel really strongly that we're going to have a great price. And again, just wanted to kind of highlight again this Premier network. So again, this is the core, now being referred to as the Premier. If you go to our finder provider, and I'll show you here in a few slides, but when you're doing a search, you just want to click that bronze, silver, gold portfolio. That'll show you kind of our full boat. And again, it's our broadest network. It's available in all of our counties throughout the country. The diabetes specific plan, it's going to be offered in Florida, a lot of different states throughout the country. That is a Premier network plan. And again, you'll want to choose that when you're doing a search on our finder provider. And then the adult vision and dental buyouts are available on these plans as well. Just some plans I wanted to highlight, and I think kind of no matter where you're looking, you should see probably these couple as our most competitive in the marketplace. The Focus Silver, I think it's probably our most popular plan right now currently. So it will continue that way. Low copays. I'm not going to bore you with all the details, and I'll make a plug. I'm going to talk about the broker portal here in a little bit, but under the resource tab in the broker portal, we have a great, there's a ton of resources in there that you can pull plan grids for specific states that have kind of all the cost share across the board, where you can look at, okay, hey, maybe these 2 or 3 plans might make sense for my member. What are the give and takes with these, right? So the Focus Silver, again, low copays, deductible, $0 deductible, low max out of pocket. Then the Standard Silver, again, this is kind of that CMS standard plan that the design that we all have as carriers across the board. This is going to be our lowest cost silver in some markets as well. Again, $0 deductible, kind of some trade-offs with the co-insurance max out of pocket compared to the Focus Silver. Our Everyday Gold, so that you are going to see some markets, I think Broward specifically in Florida, where our gold plan might actually zero out depending on somebody's income. I'm sure you guys are all familiar, right? When you start thinking about the hierarchy of plans, gold being a little bit more expensive than the silver, typically you get better cost share, more higher income folks that aren't going to qualify for those cost share reductions. Really good fit here on the gold plan. So $750 deductible, $7,000 max out of pocket, $0 copays for virtual care. PCP visits, $35 copay, specialist, $55, lab, $35. These plans, again, typically for more higher income folks, but still a great option. The adult vision and dental buyups. So on the vision side, $0 copay for eye exams. We cover eyeglasses up to $130. Same with contact lenses as well. And then for the dental, kind of the main call out here is I think when we talk about medical side, we talk about the max out of pocket. So like when you hit that as a member, everything falls back on the carrier. On the dental side, we have a max benefit. So once you hit that $1,000 for the calendar year, it does fall on the member. Really anything other than just the routine cleaning, it's about a 50-50 between us and the member. And then off exchange plans, we are going to offer these. We're also doing ICHRA in a few states. We're piloting that this year. If you go to Health Sherpa, there's that option. Would you like to see if you qualify for financial assistance or no? You select no. These plans, again, low deductibles, primary care and specialist copays tend to be cheaper. Again, usually higher income folks that aren't going to qualify for these subsidies. They don't have to go through all the different details of the typical enrollment. And again, they're going to have the same provider network and formulary on exchange as what we have on exchange. And I mentioned, we have about 4.5 million members today. How did we get there? I think the first thing, a thank you to you as brokers. I think we have a really strong partnership with brokers. I mean, our membership is probably, depending on the state, anywhere from 50 to 60% brokered. We have a ton of brokered membership throughout the country. How do we get there? Competitive commissions. I don't have the commissions today, so I won't be able to show you. Those will be coming out, I would say, over the next few weeks. We're still kind of just locking down details on each state. We have account executives that are dedicated to a successful partnership. So there's somebody dedicated to being able to work with you specifically. We have a sales support team, so if you have issues, they can help deliver quick solutions. And then our broker portal, which we'll get into here in a minute, managing your book of business. There's material, there's training. We are going to have webinars for all of our states. You should have received an email over the last week or so to register. We'll go into each state specifically. There's usually about 2 for each state. And then we'll also have some trainings that are in the broker portal specifically, a little bit shorter videos that kind of go over maybe plan design, or some of our member benefits like My Health Pay. So the broker portal, this is kind of the main page when you log into your broker portal. We show how many total active members you have. We have a pie chart that looks at delinquency. So, are they 30 days, 60 days, 90 days delinquent? And then also unpaid binder payments. So I think that's a big one during this time of year. You enrolled the member. Have they made their payment? We show all those policies that fall in that bucket that has not made the payment there. And you can pull that there. It's kind of small to see, but if you've been in the portal, there's a hyperlink that says view all of these. If you click on view total active members, it'll take you to show all your active members. Same with the other delinquent reports and unpaid binder payment reports. Also, if you click the policies tab, it'll take you to this screen. This is anything that you've ever written that's still under your national producer number. So even if it's a plan that canceled, years ago, if you're still listed as the agent of record and they haven't enrolled somewhere else, that will still be in here. Pretty much everything that we get on the enrollment for the member, as far as demographic information, we populate in here. Some different ways you can filter this, actives, delinquents, unpaid, come tax time. If somebody lost their subsidy, we have a filter for APTC decrease that will show all the policies that you have that have lost their subsidy throughout the year. I think a great tool with this, you're able to export this into an Excel file, makes it a little bit more manageable, especially when we're talking about delinquencies. If you have office staff or somebody that helps make phone calls for, hey, these folks need to make their payment. I think it's great to pull that out of there. Within the policies tab, all of the policy numbers kind of a Raspberry hyperlink. If you click on that, it'll take you to the policy details for the members. So it'll go through everything. What's their premium? What's their tax credit? What's their, monthly, responsibility? The dependence on the plan. This is also where I mentioned the renewal letters will be in your portal. They'll be in this for each plan. You can see payments, invoices. You can order ID cards through here. The other update that we have this year is you've probably seen some of the states you're now able to set up auto pay. All of our states you're going to be able to set up auto pay for the member through the member portal or through the broker portal. And again, I think we talked about the reports, delinquencies, unpaid. You can pull this all out. You can filter however you need to in an Excel file. Just at the top, wanted to go over this. So there's the quick pay. That's where you can set up like a one-time payment. If if you're going through your delinquent report, talking to a member, hey, you need to make your, February payment. You can do that for them on the phone. You can go to the quick pay, get their details, and do that one-time payment. You have access to enhanced direct enrollment through here, the enrolling client now. It is through Health Sherpa, but it will only show Ambetter policies. As much as I'd love to think that, all you're ever going to write are Ambetter policies. I don't think it's necessarily super useful for your day-to-day, but if you do have off-exchange enrollment, this is where you would go to do that enrollment. It's through our Health Sherpa link. And then you can get to the Find a Provider from here as well. The Resource tab. So there's, a couple different folders within there. There's the forms, we're kind of outside. All these are in a blackout period right now, but like release forms, things like that are in there. Training materials, tutorials, plan info, product content, reference guides, and then marketing materials that are state specific. Everything in there for the most part is bilingual. And we have, English and Spanish for each state. We have a social media guide. So, there's some already kind of created posts that we have kind of approved for Facebook, Twitter, things like that. But then also just best practices for marketing as well. We kind of already talked about this, but the renewal letters will be in your portal here shortly. The payment options, you can set up auto pay for your members throughout the portal, as well as that one-time payment. Some benefits for your members. So My Health Pays. Hopefully you guys are all aware of this if you've worked with us in the past. But members can earn up to $500 in rewards. They earn points by completing specific health screenings. The onboarding and well-being survey for new members. PCP wellness exams, so just getting your yearly physical. Comprehensive diabetes screenings, quality measures, childhood immunizations, vision screening. For women, cervical and breast cancer. For men, cholesterol and colorectal screenings. Blood pressure screenings for adults, and kind of what are we doing here, right? We're rewarding people for doing healthy behaviors, and how does that help us too, right? When folks are going to the doctor and getting tests done and staying on top of their health, things are able to, typically we're able to catch things sooner. It's a lot easier, not only for the member, but for the doctors to treat, say, stage 1 cancer versus stage 4, right? This helps keep claims down, but it also helps the member stay healthier. And how they get there, they go into their member portal. There's a rewards tab. They click that. They click Get Started. It'll take you to your My Health Pays portal. Some other ways they can earn that are outside of just kind of doing health screening. We have some fun and easy activities, a lot of videos, or maybe it's a challenge to walk X amount of steps throughout the day or throughout the week. How we reward them is we give them points. We have an online store. It is not Amazon. There's nothing that you need to get out of the online store. I would highly recommend that they convert the points into dollars to pay their premiums and other healthcare related costs. What we do is when they can do that conversion of the points, we send out a Visa. It looks very similar to like those Visa gift cards. They can use that for, paying their premium, co-pays, things along those lines. Really, the only thing healthcare related is it's one of those ACA rules. They just can't use it towards prescription co-pays. Member discounts, another perk that we have is Ambetter. If you've ever kind of worked a corporate job, sometimes they have, rewards programs for employees, like off of gym memberships, ordering meals like HelloFresh, things like that. Ambetter is our program for our members. They go to their rewards, they would click Get Started, and they can see all the different, rewards that they have. I mean, things like 15% on rental cars through Hertz, things along those lines. One last member benefit I did want to talk about. This is a pilot program only in North Carolina and Arizona for this year, hoping to broaden it. But we are doing a pilot, and it's actually started for current members here in October with the YMCA. So if you're a member in North Carolina and you get an Ambetter plan, you actually can get a free membership to your local Y. my plug for the YMCA, I grew up, playing basketball, flag football, everything there. That's where I learned how to swim. It's a great opportunity for our members to get out, get into the gym, live healthier lives and be more active. Moving forward here, virtual care. So we are partnered with Teladoc. This is $0 copay on all of our plans except for our HSA. Again, that's one of those kind of ACA regulations. I know the folks from Molina were talking about this too, but it's great for non-emergency issues. I mean, I think if you're having a heart attack, please still go to the ER. Do not do a virtual visit for that. But great for when you're not feeling well. I've used Teladoc before when, I know I kind of have a sinus infection. I feel like crud. I don't want to get off the couch. I don't want to have to wait a week to see my PCP. I can do a call. You're going to talk to a licensed physician. They're going to be able to write prescriptions if you need it. Also great for mental health visits as well. So if you're going through a mental health crisis, you can log on to Teladoc, have a conversation with a licensed therapist as well. So all of that is $0 copay for Ambetter members. Then lastly, try to rush through these last couple slides. The member portal. So if you log in, members can, they can choose their PCP, they can see claims, they can update, get their ID card, they can order ID cards. This is where we link out to Teladoc as well for 24/7 virtual visits. And then the app, I think we talked about this. It's basically a mobile version of the member portal. And last but not least, the guide. So best results, we would ask that members log in to their, as their member, use the same login for their member portal. That way we'll pull their plan info and they can see, all the providers that participate in their specific plan. The other is you can search, picking the home state, what year, the county, and then obviously the plan type. We talked about some of the different ones like Premier, Virtual, Select, all that. You do your search. This time we did primary care Miami. It'll pull up all the doctors that fit the criteria. All this information that we get is from the time of contracting so this is what the doctor provides to us as far as, are they accepting new patients? Do they offer virtual visits? One caveat to that, I know I said, virtual visits are $0 copay. That is only through Teladoc. So if your local doctor does do a virtual visit, that will be subject to the normal copay. If it's, a $5 copay, if you went in person, it'll be a $5 visit with that specific provider. Really have all the information you could want about a provider too, where they're at. Are they bilingual? Like what affiliations do they have as far as network? Phone number, all that. So hours of business, it will all be listed here. And how you get there, you go to For Members, and there's a Find a Doctor, but then also the formulary list. For Members, drug coverage will take you to this page. You click on the formulary prescription drug. It's a very long, it's about an 85-page PDF. What I would do is hit Control F, type in the medication name. It will, if we have it, it'll populate. You don't see it right away. I always try to use like a generic version. Occasionally, maybe we don't cover like the kind of the name brand version of the drug, but we do have the generic drug on the formulary list. And that's all I got on my end. Thank you guys for the time.
Awesome. Thank you so much, Mike. Doesn't look like we have any questions, so I'd say you are good to go. And yeah, we'll toss this one over to our own Sandy Marrero. He's going to talk a little bit here about the America's Choice Plan. It's just another option during the ACA timeframe and something for your clients. So Sandy, are you ready to go?
Yes. Can you guys see my screen?
Yep, we can see it.
Okay. So thank you very much, everyone, for joining us. This is Sandy Marrero with Taylor. We are the one who handle the ACA and the alternatives that happens. As you know, has been a lot of disruption in the market, especially on the areas of the short-term medicals and things like that. So what we are trying to do, we always try to do at Western Marketing, is to bring you guys the most available products that can actually mitigate those issues. earlier this year, there were some issues regarding the way the system was, or the short-term medicals were actually being handled. So they went ahead and changed it from, give me 1 second, let me check something here. I apologize. Can you see now better? All right. So I think I was actually trying to do some changes over here. So like I said before, like earlier this year, the ACA changed, or the Medicare Center changed the way the short-term medicals are done on a monthly basis. So the short-term medical went from 12-month benefit period to a 4-month per carrier. We have developed a relationship with a carrier that is actually a type of policy that actually give you an opportunity to offer an alternative to a major medical and also a short-term medical. And this company is called America's Choice. These America's Choice products are developed on a group chassis, and what they do is that you can sell it individualized. So you can actually sell it to people with a least $600 on 1099 as an individual. And they do have quite a bit of a nice product, which comes with a deductible coinsurance, similar to what an ACA plan does, but with the added benefit that you don't have to worry about qualifications and in terms of how much money they are making on a yearly basis, because that's not based on that. This is also another alternative for people who are actually in transition, and they do have a job like an Uber driver, or they do roofing or things like that, and they do not have enough money to qualify for an ACA, but they don't want to be on a Medicaid situation because they have other things. So these plans have 3 different categories of those. One of those categories is a maximum benefit. The maximum benefit plan is a plan that goes to 1 million maximum with a 5 million maximum lifetime benefits. They also have 3 categories. One of the categories is a sick care or Blue Cross Blue Shield network plan, and a metal plan, which is dedicated with a similar to an ACA major medical, which has the diamond, the titanium, the platinum, and the gold and silver and bronze plans. Those are your normal plans with your normal deductibles and coinsurance, with a network with a PHCS or multi-plan network. Now, what is America's Choice? America's Choice health plans is integrated with your business into the popular science management model by doing different things like having a dedicated network, like a PPO network, such as Blue Cross Blue Shield or PHCAs. In this case, we do offer the sick care system, which is actually the nationwide PPO network with United Health, with Blue Cross Blue Shield. And that allows that for them to use the Blue Cross Blue Shield of Nebraska, which is the carrier that actually is offered for the nationwide. So if you allow me for a few seconds, I'm gonna get out of here for 2 seconds, and I'm going to show you how these plans work in a more easy to understand plan. So in this case, we do have the America's Choice maximum benefits. The maximum benefit plans, we're gonna try, they go from a deductible of $250 to $750. If we were to go and see these plans, you will notice that your benefits plan information is only based on the deductibles and whatever the co-insurance is that you have to pay. And then the carriers will pay whatever the amount that the doctors is going to charge. These plans, this summary that I'm going to be showing you, will cover prescription at 100%. You don't have to worry about co-payments for prescription. So again, $750 deductible and a co-insurance of $1,000, or co-payment of $1,000 on those plans. There are some benefits that are not covered on these plans, like with dialysis or children's exams eyes and mental health services exempt from telemedicine, organ transplants, and children glass and children dental checkup or acupuncture. Those are the services that are not generally covered for this plan. But for the most part, most of all the coverage, like cancer screening, colonoscopies, diabetic, immunizations, and prescriptions and telemedicines are covered as well. As you know, if you do have a plan like this, you would think that this will be a very expensive plan. In this case, it's not. It is age-banded. The premium of these plans range from $289 all the way to $409, depending on the age of the person that is enrolling in the plan. It is age-banded, like I said before. It goes from 18 to 29. You get that $289. You'll notice that it will say employee on the plan, but you can sell it individually. The reason why they say employee is because it's created on an employee base in a group plan setting, but it can be sold on an individualized basis to anyone that can provide a 1099 for at least $600 on a yearly basis. For comparison on any other plans, you will notice that these plans will have, like any other plans, physician's office visits, telemedicine visits. You have a copay of $50 for those outside of the deductible that you already have. But if you are put in a situation that you have to go to an emergency room or an inpatient service, and that inpatient service costs, say, $250,000 to $500,000, the only thing that you have to worry about is that deductible of the $750 or $250 or $500, depending on what you choose, plus that $1,000 co-payment on the admission. That's the only thing that you have to worry about. Everything else is going to be taken care of. If you're having a person that is having a pregnancy, a person that is in a pregnancy situation and they're having a delivery, they only have to worry about the deductible again, and then a co-payment of $250 for the admission, and or $500 depending on what type of delivery is being done for the pregnancy. It could be a C-section or a routine vaginal delivery. Now, all maternity services are covered at 100% with this plan. They do offer some benefits, and they do have a maximum benefit on that delivery of $15,000. So the only thing that you have to worry about is that $750 or $250 deductible, or plus an additional $500 co-payment, and then they take care of everything. Plus, the maternity services are 100% covered for the child, for the newborn. They do also offer some benefits from home health care, skilled nursing, and hospice care. You just have to worry about paying the $50 co-payment, or a zero co-payment if it's a home or hospice service benefits, which a maximum benefit of $5,000. Therapy is also included in the plan for chronic chiropractic, cardiac, and PT, OT, or ST. There's also durable equipment embedded on the plan as well, plus infusion and chemotherapy or radiation for people who has cancer. The only thing that they have to worry about is the $100 co-payment in the deductible, and then the plan will pay up to $50,000 for the injection of the drugs on the infusion or the chemotherapy or radiation on those plans. This is a very unique type of plan. The diabetic services and allergies and prosthetic services are also included. But we'll pay the benefits for zero copay for diabetic nutrition counseling and anything that has to do with diatribe or non-diatribe for $250 maximum benefit for a year. It does not cover, like I mentioned, that dialysis or organ transplant. Children dentistry either is covered with this plan, but it is a very robust plan to mitigate those plans that you are losing on the short-term medical side because of the state's mandated systems that they have to go you have to enroll within 4 months with each individual company to be able to get that plan. So no longer you can have those 12-month plans. Although we are working on other alternatives with other carriers so that you can actually enroll on 12 months consecutively. And like I mentioned, these plans, the benefits on prescription, you do not have to worry about copayment. It will be covered on this plan, which is a maximum benefit of $1 million. And the plan will have a formulary that will give you access to 1,000+ generic drug medications that you can actually have access to. And those medications that you'll see that they have quite a bit of benefits on those, especially on the diabetic medications and things like that, infections and cardiovascular product. So they do have a free home delivery for those on those prescription benefits. Once you have used those, if you need to go to any pharmacy, any local pharmacy, you can use that twice if you're running out of time from your delivery because it's all mail order. But you can utilize any local pharmacy of your choosing with a zero copayment. And those again are called the maximum benefit plans. It is available in all states but 6 states of the union: California, Hawaii, New Hampshire, Oregon, Vermont, and Washington. This is available in Massachusetts, New York, New Jersey, and Connecticut. For those of you who have clients in that area, you can use these plans in those states. Another good thing about those is that if you buy those plans on any states that are available, you can still utilize the network on California, Vermont, Washington, or any other states that are not on the plan. These are very, very unique type of plans. The network that these plans are using is the PHCA's network, which is the multi-plan that you can actually utilize on any of your states. Okay, so please take a look at that and see if your doctors are in that area. If you were to enroll someone on this plan, it's a very easy enrollment process. You will choose any date, and then you can update the plan. It will give you the pricing of the plan. In this case, for this person that was born in 1984, it will be $349. Then you can continue to the enrollment process. And it is a one-page enrollment process which has different health questions. Okay, you can pay with a debit card or credit card or a PHCA or a bank draft. Once you complete the application, the client gets a text message or an email with the code to actually confirm the sale, and then you are on your way. Notice that you have at least 11 health questions that is a pre-qualifier for this plan. Once you answer no to all the health questions, then you will be able to proceed. The plan also has a unique version where you don't need to have a verification of income to qualify for these plans, so long as you have, like I said before, a 1099 or at least $600 or more. If you are a person who are in transition and you haven't acquired your Social Security, they will take a IT number in lieu of the Social Security number. Okay, so just wanted to make you aware of that. You can change language if you use a different language than your main language, or English. Okay, no, that would be the plan that we call the maximum benefit plan. But if you do not want to have a limitation on your plans, then we recommend you to go with the sick care system, which is our PPO network that I mentioned earlier. In this case, we're working with the Blue Cross Blue Shield network. And this Blue Cross Blue Shield network, which is the Blue Cross Blue Shield of Nebraska, is the nationwide network that we are using for this plan. Again, it's similar to any other type of plan, major medical plan. You have in-network and out-of-network benefits. The network goes from $5,000 deductible to $1,000 deductible, depending on which one you choose. And for this sample, I choose the $5,000 deductibles. You have your coinsurance. In this case, it's an 80/20 coinsurance, out-of-pocket limits, and also the same situation that you had, or the same benefit that you have with any other major medical. You have your copays, your specialist benefits, your physician's office available in copay, and you have your deductibles and copayment for urgent care. You do have your outpatient hospital and facility benefits, which is all subject to deductibles, inpatient hospital and facility services as well. And of course, for preventive services and immunizations, immunization is covered 100%. And then for prescription benefits, it is all subject to the deductibles and coinsurance. Those are the benefits on the sick care network, or PPO network, which is the Blue Cross Blue Shield. If you were to go to if you are looking for a network provider, this is where you go, to the Blue Cross Blue Shield of Nebraska, but this is a nationwide network. It covers everywhere. So you can actually choose the location or the place, and you'll find the actual doctor or hospitals that you're looking for. Now, pricing on these plans are a little bit different than on your maximum benefit. If you were to go for this type of plan again, and we'll say we have a 50-year-old with this plan, that would be actually $697.24. It's not your typical major medical on the ACA, or your the maximum benefit that I mentioned a little bit earlier, because the ACA will have a subsidy that is going to be provided to you by the government. This one is a direct monthly premium of $697.24 for a 50-year-old, and it is not subject to subsidies. This is not a subsidized plan. However, you don't have to worry about qualifying based on income for those. The only thing that you have to worry about is providing a 1099 that you have at least of $600 or more on income on annual basis. If you think that this is a little bit pricey on the Blue Cross Blue Shield, we have a different alternative, which is the metal plans, which are the similar plans as major medical with on Obamacare or ACA. In this case, we're gonna use the same $5,000 that we had on the Blue Cross Blue Shield network, and we'll find out what the pricing is. Same benefits, $5,000 maximum benefit, with a deductibles and coinsurance and copayment This plan utilize the network of the PHCA's or multi-plan, like the maximum benefit does. It does covers exactly everything, diagnostic, complex. The benefits for preventive services are covered at 100% of allowable benefits, like the same benefits that you will find on an Obamacare, like mammograms, routine colonoscopy, and well care or newborn care. The difference between this one and the Blue Cross Blue Shield plan is that this plan has a lower premium. The premium on these plans are $582 and is age banded. It depends on the age of the person. It is age banded, but the rate is a little bit different. Prescription is subject to deductibles and coinsurance. You have 30-day supplies on retail pharmacies, and then $10 copay for generic, $45 copay for brand medication, and also you do have specialty mail order that is also offered on this plan. And you do have different type of plans. You do have the bronze, the copper, the platinum, and the gold and silver. The only difference between all those plans are the premium that you have based on those plans. And again, you utilize the same network on these plans. It is available like the other ones in all states that the other plans are. All plans are in the same states except California, Hawaii, New Hampshire, Oregon, Vermont, and Washington. For contracting with this plan, it's very simple. You go to the link that we provide to you, click on here, type USA, and then you will be able to get contracted easily in one-page contract. Once you have applied to the to get contracted with this plan, you'll add your license on the same contracting link, and then you will be on your way to starting to submit application with this plan. Two keynotes on these plans is one of the keynotes is that these plans are issued on the first day of the following month. If you are applying for the Blue Cross Blue Shield network plans, these plans are you can submit application between the 1st of the month through the 20th of the month, and the policy will be issued on the 1st of the following month. If you submit an application after the 20th of the month, then it goes to the following month. So instead of, for instance, we are in October. If you enroll now, your effective date will be November the 1st. But if you enroll in after the 23rd for the Blue Cross Blue Shield network plans, then your effective date will be December the 1st. Then in another case, if you enroll on the maximum plans or the platinum or the metal plans that you have over here, those plans will be actually effective between the 1st of the month of the following month, but you can actually sell those between the 1st of the month all the way to the 23rd of the month. It'll give you an additional 3 days to enroll on those plans. There are plenty of training that we do on a monthly basis with these plans. It's a very unique type of plan, and the commission is very, 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 very nice commission. So I would recommend everyone that is in the online with us today to please reach out to Taylor or someone over here or Western Marketing, and we'll be more than happy to talk to you about commission structure. We typically don't like to talk about commission structures on training. But this is a very good alternative for you guys to do a way with if you are losing coverage, especially in Illinois, that people are not going to be able to sell short-term medicals anymore, or any other states that you may find a difficulty trying to find a plan for some of your clients, like New York, New Jersey, or some other states that you may not have those. Okay. With that, I believe I'm done with this part of the training, I'm gonna give some extra space to Taylor to get ready for the next person. Taylor.
Well, we're actually still waiting on them to hop in here, so they did say they'll be on here in a minute or two. So
that's fine. Then in that case, why don't we do this? Yep, that's fine. Why don't we do this? Let's try and see if we could within the next 2 minutes try to get and see how what network if we can pull out some hospitals in the network. How about that? Let's see if we can just go here and find a provider on the multi-plan. Okay, and what we're gonna do is we're gonna try to see if we can select a network first, which in this case, see, I'm not a robot, and then it's gonna tell me to verify the stairs. I'm gonna verify some stairs here. I'm gonna verify the stairs. Then I'm gonna choose the multi-plan. I'm gonna do the PPO for now. They normally recommend us to use the PHCS, but I'm gonna do that first. And then we're gonna do Nebraska. Okay. Okay. And with that, we have all the hospitals like CHI Health, Creighton, Midwest, Nebraska Methodist, and Midland. Of the those are the hospitals that we can have that we have in Nebraska. We can utilize another network, but just wanted to give you a brief information on how you locate those plans. So, like I said before, we can do training on a monthly basis with you, and in one-on-one, and we can go over some other key benefits that you can add to those, of course. Right. That said, let's just give that back to you, Taylor, and then we go from there. Let me give it back to you.
Perfect. Well, it looks like we are still waiting on Adrian to join here. We'll give him a minute or two. We did have a couple questions that
go ahead.
Popped up, so I guess we can run through those real quick.
Why don't we do that? Yes. Mm-hmm.
The questions, one of the big ones was pre-existing conditions. You want to go over the pre-existing conditions? And
Definitely. Of course. The pre-existing conditions on these plans are, this plan is a plan that has 11 questions. Once you have gone through those 11 questions, which are these ones that I'm gonna show you here. Once you have gone through those 11 questions, if you have answered no to all these health questions, then you are free to go. Everything will be covered on those plans. So if you have, for instance, have you or anyone or dependent applying for coverage been under the care of a doctor currently or in the past 5 years for any of the following, like heart attack, stroke, or surgery? Or if you say no, then we go to the next one. Have you or any other dependent applying for coverage been bound, incapacitated, or self-bound due to a medical condition in the last 5 years? If it's not, then you go to the next one. Have you or anyone dependent applying for coverage been under the care of doctors currently in the past 5 years for autoimmune or blood disorder, like lupus, anemia, HIV, or AIDS, or hemophilia, IBS, or Crohn's? If it's no, then we go to the next one, which is have you or any dependent applying for coverage been under the care of a doctor for kidney, liver, lung, heart, or any form of organ support, like dialysis or something like that? Or are you or a dependent applying for coverage currently pregnant or expecting? Now, I want to stop there for a few minutes because pregnancy is covered on this plan. So if you are not pregnant or expecting, when you enroll in this plan, and then a month or 2 months later you get pregnant, you get in a pregnancy or expecting, then the plan will cover you. Now, let's say that you have a family, husband and wife, and have a child, which is also a child that is 21 to 22 years old, and that person, that child, which is a dependent, get pregnant. Well, that dependent's pregnancy will not be covered because it's a pregnancy of a dependent. In order for that pregnancy to be covered, that person has to have their own coverage. That 21-year-old will have to have their own individual coverage. That's the only thing that will not be covered when it comes to pregnancy. Now, you answer no to those health questions, then you go to the next question, which is in terms of hospitalization. In the past 4 years, are you being treated for a condition for which you are being hospitalized in the past 5 years? If you say no, then you go to the next question. Have you or any of your dependents applying for coverage been under the care of a doctor for chronic bronchitis, COPD, chronic pneumonia, or emphysema? If you say no, then you go to the number 8th question, which is in the last 5 years for musculoskeletal disorder or that's dystrophy or cerebral palsy or dermatomyositis or syndrome of sciatica. If not, then you go to the number 9 question. Have you or any of the dependent applying for coverage been under the care of a doctor for substance abuse dependency? Now, in that one, if you click on no, then you go to the 10th, which is I want to pause on the number 10th, which is if you are a diabetic. Notice that in the last 5 years, have you been under the care of a doctor for the past 5 years for type 1 diabetic? If you are type 2 diabetic, you can answer no to that question, and it will be covered. You will be covered for type 2 diabetic. It's an insulin-dependent diabetic that will not be covered on this plan. Okay, and of course, if you develop a diabetic, if you become diabetic, once the policy is in place, then the policy will be in place. And then finally, in the last 5 years, in the past 5 years, have you or anyone applying for coverage had any surgery that you are still being treated or have an upcoming planned surgery? Of course, if you're having a planned surgery and you're buying this plan, the plan will not be covering that surgery if it's something that you already have planned. Do keep in mind that you are the underwriter of this plan. Once you submit the application, this plan will go into effect. So the plan will not be going through underwriting. It's a simplified issue with 11 easy questions. There's no further underwriting on these plans. Once you go into a claim, and if they find out that you lie on the claim on the application, that's when they do any information. I want to go over, if you still have some time, Taylor, do I have some more time?
Yeah, he's not in here. I mean, worst case scenario, Mark, are you ready to go? We could have you hop in.
Okay, let me just add this well, if he's not there yet, which is a very important highlight on this, which is, again, age banded, 18 to 29, 30 to 44, 45 to 54, and 55 to 64. Based on 4 age bands, primary applicant is then there is the 1099 business owner when applying, if he's a person that this is a great plan for agents that are or agencies owners of an agency that have agents under them. Is ACA compliant? All plans are ACA compliant and meet minimum essential requirements for the MEG plans. Simplified issue with 11 easy health questions. The billing is monthly. Qualification, the only qualification that you have to worry about is that 1099. Personal health dashboard, a secure online personal portal for full range of resources that you can have with this plan. And the benefits, you have 70+ urgent care medications at no cost, affordable medical imaging, balanced bill services, concierge support services, diabetes care, discounted lab pricing, and health coaching. You also have pre-certification and prescription and pharmacy care. You also have that discount lab pricing and things like that. So, and then if you want rates, you can actually take a picture of those of these barcodes down below that you can actually see the rates on that. Okay. With that, I'll see if I can pass it through to Mark if he's available.
Mark, are you ready to go?
Oh, I can be.
Perfect. Yeah.
All right.
It sounds like Cigna's having trouble getting in. So if you're ready to go, Mark, we can hop you up early here. So thank you, Sandy.
No problem. Thank you very much, guys.
But let me pass over the presenter. Perfect. And then, yes, perfect. You are showing. So everyone, this is Mark with Anthem. And so he's going to go over both the Anthem information as well as the new Wellpoint information that I know a lot of you are pretty excited about. Mark, you're muted right now, but you are ready to go when you're, as soon as you want to go.
Yeah, I'm just trying to make sure I'm sharing the right screen. What are you seeing? Do you mind?
Wellpoint is what we're looking at.
Okay. Where's my? Now you're seeing the black screen around here, right?
Yeah, we're seeing the presenter side.
All right, that's better, right?
There you go. Yep, you're good.
Awesome. Well, guys, I appreciate the opportunity. Very exciting over here at Elevance Health as we are expanding into 3 new states under the Wellpoint brand. So really excited about that, and really excited to sit with you guys and go through some of this stuff. Hopefully we have enough time for questions. If you have any, feel free to, I'm not sure if that's allowed, but I just went ahead and said it, but feel free to throw it in the chat. Be more happy to address any questions that pop up. Because of time, I'm going to go kind of quick and skip through some stuff that may not be as crucial. But for now, I just really want to talk about Wellpoint. You know, I was introduced as Mark from Anthem. I'm actually with Elevance Health. So I'm going to talk about how that structure works and how it works for the Wellpoint states as well as the Anthem states. As you go into there and start offering these plans and products to your clientele and the markets, understanding what tools are available to those clients and those members. Also from your perspective, what's available as a broker, what tools, how can I service my clients, what's available on that side. And then jump into the 2025 product service areas as well as the broker support. I will go through some of those quickly because I do want to hit some of the Anthem states as well. So let's talk about Wellpoint. So I was introduced as Anthem, which was the parent name. As you can imagine, Anthem was the one that was listed here as Elevance Health. A couple of years ago, Anthem and rebranded it, this company called Elevance Health as the parent company. So Elevance Health is the parent company, and underneath that parent company or the umbrella, you do have Anthem, Wellpoint, Carelon, who does our pharmacy benefits, Mayor Group, which you guys may be familiar with that company, Simply, who's down in the Medicare market down in Florida. There's a lot of different health insurance type companies underneath the Elevance Health umbrella. The ones that you really are focused on really are the Wellpoint states and the Anthem Blue Cross states, and of course our pharmacy benefit was Carelon. So just want to make sure people are clear when offering plans and products in Texas, Florida, as well as in Maryland, that it is Wellpoint and it is a part of the Elevance Health family of companies, which does include Anthem and all the other ones out there. So hopefully that helps understand kind of the company dynamics and kind of how everything falls together. So as I mentioned here before, we are going to be expanding into Texas, Florida, and Maryland as a new ACA offering or ACA product in these states, and we're going to be new to those states. So this is pretty exciting stuff. So as you're offering Wellpoint plans and products to your clients, it's important to know what tools, what resources they have available. First one is, we have a website. It's wellpoint.com. Once these members, clients get enrolled, they can go onto the member portal, register themselves, and be able to have access to pretty much everything they need. ID card, billing and claims, prescriptions, locating providers, pharmacists, downloading health records. I mean, there's basically everything. We give that member everything they need to feel good or be able to access that information without having to call you, the broker, or in many cases, calling us to carry. They can call us, but in some cases, if they have this information or have this stuff that they can go out and get themselves, it's a little easier, and sometimes it's preferred by them as well. Also, I know everybody uses third-party quoting engines that allows you to put in doctors and prescription drugs to see if it's in the network or it's covered prescription. Wellpoint will also be out there and should have all that data information out there for your use especially during this busy time during open enrollment. If for some reason it's not working, or if your client wants to do some additional research, they can go out to wellpoint.com. They can click on Find Care. They can search with a member ID, or they can search as a guest. There's only one network in each of these states, which makes it easy. But more importantly, just to let you guys know that it is out there, and you can go out there and start playing around and start checking it out now if you'd like. If you're going to write anything down, please write this down. This is our Sydney Health app. This is a really game changer. I get real, I know a lot of people offer plans and products, but they won't introduce the tools that are available. And if you do, that's great. But our Sydney Health app really is a game changer when it comes to having everything right there in the palm of your hand. It gives you 24/7 access to everything, claims, benefits, access to your digital ID card, which, by the way, if you're in the doctor's office and they say, I need a copy of your ID card, from the app, you can go in there and find your ID card, yours, your spouse, your kids, and then email and or fax it from the app, which makes that pretty user-friendly on that aspect of it. You can go in there and make payments if that's something that needs to happen, order prescriptions, download your health records, find providers, but also be able to have access to virtual health care, which is a big deal now. People have busy lives, going from work, picking up kids from school. Sometimes it's not enough time in the day to go see a primary care doctor or a doctor for something that maybe it's sickness, allergies, maybe it's a pink eye, rash, maybe it's severe, whatever. Being able to do that from your Sydney app through your device makes it really easy. And one thing you'll learn is that those services and those virtual care visits through Wellpoint are absolutely free. It's a 4.8 stars on the app through the iStore, through the Apple Store. 4.8 is pretty good, considering we have close to 16 million registered users. So if it wasn't a good app, I would assume that our star rating would be much lower. But it really is a fantastic tool for your members to have access to, be able to use and manage their health benefits. The Sydney app, and again, through that virtual care doctor, gives people access to a licensed therapist for mental health. If they have stress, anxiety, depression, family issues, or other health concerns that they would need to see a therapist about, that is available. If you look at the picture there, you'll see that you'll see English, you'll also see Spanish, which makes it user-friendly for a different variety of different members out there, depending on their language preference. Also, their therapists are also available by appointment when needed. So there's a lot of great things that's available to you on the Sydney app. One of the other things that I'll mention here is we do have incentives for clients and members. These incentives, I would say, are probably not as rich as other carriers, but it is a part of the plan name, so I wanted to make sure that I go over it with you guys. Our incentives are that we give, if the client member gets a wellness exam or a well woman exam within the first 90 days of their plan, they'll have available a $50 gift card, or it can be a gift card to a variety of vendors, or I think the Visa card, if they want the cash, is out there as well. The other one is a health assessment, which is only $25 for a total of $75, which again, it's easy to access, easy to get, stuff that really you should do already. But on the health assessment for 2025, this is new. This is our social care program, which is a community connect care and ground game health. This helps people with housing and utility, food, and transportation. Once they complete it, they can determine eligibility. And if they are eligible, someone will reach out to that individual directly. So it's not a bad thing. You get $25, you get $50, $75 total to do a couple things that they should do already. But again, it is a part of the plan name, and wanted to make sure that you guys were aware of that. So on the broker tools, the broker tools and the broker producer toolbox that we have available is at Wellpoint, wellpoint.com. As you're out there offering these plans to your prospects and clients, know that if they do need an ID card, again, making sure you push them the Sydney app, because that's the way they don't need to call you and bug you guys, while your main goal is to give them a great experience and ask for referrals. But if they do end up calling you, letting you know that you do have the option and availability to go to your producer toolbox at wellpoint.com, search your client, pull their ID card straight from the dashboard, email them over to them if they need it. There's also billing reports, including late reports in there. Also, it's not listed, but we also will have renewal reports out there for you. Members that are turning 26 off their family plan, or members that are turning 65 into the Medicare, there are reports out there for that. Summary of benefits, prescription drug lists. Depending on the size of your book or your agency, you can also set up delegates within the producer toolbox. So maybe you don't want your admin, for example, to have full access. You just want them to have certain access points. You can set that up through the toolbox as well. So a lot of great stuff there within the broker toolbox. The ID cards is the one that I hear a lot, how frustrating it is to offer a product or a carrier that you can't simply go out and download ID cards. That's not the case here at Wellpoint, especially being new in these states. So I wanted to bring that up and make sure I review that. If you're going to write the second thing down, this is it. This is the Wellpoint Broker Hub. The Wellpoint Broker Hub is the place where we are housing broker information, product grids, sales kits, network maps, marketing flyers out there, both in Spanish as well as English. We're also going to have drug formularies out there. There's a QR code if you want to take a screenshot of this or take a picture or whatever you'd like, just to make sure that This is also very important. This is where we house everything for you guys. You know, I'm sure my competitors here, you know, you guys can go out there too. We're not trying to hide anything. So it's not password, username or password protected. You just go out there, pull it, take a look at what's available out there, and, you know, hopefully you can find some good stuff to help you promote yourself and your clientele. As I mentioned, product guides, flyers, HSA flyers, service areas, it's all out there at the Broker Hub. For 2025, something to look out for is, you know, you probably, hopefully people have talked about this, the actual ACA embedded out-of-pocket max limits have actually dropped. This is the first time that I've ever seen that, and I've been doing ACA since the beginning. Usually they go up. This is the first year that I've actually seen the out-of-pocket maximums go down on the typical copay type plans or the embedded plans. For the HSA, they went up about $250 for an individual, which has kind of been the trend over the last few years. Understanding how we are naming our plans. One thing you'll see is the Wellpoint Essential. It will say Wellpoint Florida Essential, Wellpoint Maryland, Wellpoint Texas Essential. That will be the network name, of course, the metallic level, the deductible. Some plans do have adult dental vision. If that's listed there in the plan name, that means it has the adult dental vision built in. But as I was talking earlier about the virtual PCP, that's through wellpoint.com, or more importantly, through the Sydney app, where they can have those virtual doctor visits. As you can see, at no cost whatsoever. We do have a select drug formulary that will be out on the broker, the Wellpoint Broker Hub. That will be a list of generic, well-used, or mostly commonly used prescription drugs that are going to be covered at no cost. And we did talk about the incentive. So you were thinking, like, why is he talking about this? It's in the plan name, so I wanted to make sure that we kind of reviewed that in case those questions come up. In most of our states are HMOs, so you can see we don't put HMO in here. If you do see a POS, that's a point of service type plan, which is available in Texas. We'll go through that. But if there's nothing there, that means it's an HMO. Anthem or Wellpoint, we also do and have these indicators at the end of the plan name for some of the cost share reduction plans. And that indicator is really just an indicator letting you know what type of cost share plan and what level of actuarial value it contains. You probably can tell by the plan itself, the S06, which is the Rich 94 actuarial value plans. Those are going to have, you know, typically no deductible. I think this year they had no copays for primary care, $10 copay for specialists, 5 for urgent care, and out-of-pocket max of $1,800. That was one of those type of 94% actuarial value. So that's what that indicator is at the end of the day. Checking to see if there's any questions. Jumping into the state of Texas, it's going to be kind of quick here. It's kind of high level, but in Texas, we're going to be offering an HMO and a point of service plan with that 0 virtual PCP visits. We will have embedded adult dental vision as well as embedded pediatric vision. We're going to be available in 24 counties. As I mentioned, both POS, HMO, on and off exchange, bronze, silver, gold, catastrophic. These are open access plans, so there's no gatekeeper needed. In basic terms, if your client needs to go to a specialist, they go to the specialist without needing to go by a primary care doctor to get a referral. I had some questions on that before, so just making sure everybody understands what open access means. Also, we do require a mandatory PCP selection. Now, if you are using a third-party engine or a quoting site and it doesn't work, I've seen that happen before. No big deal. We will auto assign the primary care if it's not chosen at the time of application. If they want to change it, they can reach out to us and we can help them get that changed over to another primary care. As I mentioned, the Wellpoint is Texas Essential is the network name. I typically don't even talk about the pharmacy networks. In the 15 years, I've never had a problem with people telling me or reaching out saying that they need help finding a place to get medication. So we have most of the major big box office places like Walmart or grocery store chains that are in the network that people can get those filled. So I think I've hit most of this stuff here. Embedded the pediatric vision is there. No standalone specialty plans at all, and then the wellness plans. $50 for the physical within the first 90 days, and $25 for the health risk assessment. We're going to be here's the list of 24 counties that we're going to be offering these in. Would like your feedback. If you have any in the chat, would be great. So as you can see, we're going to be in most major city areas like Houston, Dallas, Austin, El Paso, Lubbock, San Antonio, which is good. These maps are out on the broker hub if you wanted to go pull one yourself and just take a look at it. Here we go. In Houston, in the Houston area, you know, we have the big ones. I think the most popular are they have Methodist, St. Luke. Over in the Dallas area is the Parkland, Kennett, San Antonio, which you can see is the University Health System over in Bexar County. Lubbock is the big one is the UNC, and El Paso, which is the Providence Memorial or Kennett. Those are in the network. Now, one thing I would say is that these are not all the hospitals. Our network is still continuing to grow. They're continuing to work with other hospital systems in the area. I just wanted to add something to this because as a new carrier, adding a little meat to the bone there, I would say, gives you hopefully a little peace of mind that you're dealing with a big reputable carrier that's going to continue to add and grow the provider team. So I've heard some good stuff about our network there in Texas so far. So hopefully you guys will see something similar. Looking at some of the plan names, I'm not going to go through this just for time, but you can pull these off the Wellpoint broker hub. Jumping over into Florida, very similar format. We do have an HMO, no POS available down in Florida. We will have the embedded adult dental and vision in some of the plans with some pediatric vision. We're also available in 24 counties. Are both on and off exchange. Bronze, silver, gold, catastrophic. It is open access, so there is no need for a referral to go see a specialist, so no gatekeeper. Same thing, mandatory PCP selection. So basically, same stuff as before. Here are the list of the 24 counties that will be servicing in the state of Florida. As you can see, most cities like Fort Lauderdale, Miami, Orlando, Palm Beach, and Tampa. If anybody is here in Florida, I hope you guys are going to be safe and stay safe as that hurricane is starting to make its way into that Tampa area. Kind of scary. Looking at some of the hospital systems, the ones that I kind of point out to me as starting in maybe South or Central Florida with the Advent Health, the Community Health, HCA, or some really good big ones down there. In South Florida, I think Kennett, Tampa General, and of course Cleveland Clinic, which is I think a well-named hospital system. And I think they also have one facility in North Orlando, which will also be in the network for the client members there in the state of Florida. Love some feedback if you have any in the chat. Feel free. Again, this is not everything. This is not all of them. This is just what I was able to gather at the time of me building this presentation, and just wanted to bring something to the table versus just a lot of basic stuff that you can find at the Wellpoint broker. Here are the plans. Jump right into Maryland real quick. So we don't have any service maps in the state of Maryland because we are servicing the entire state. We do have very similar stuff. The big difference is on Maryland with Wellpoint is we do have embedded pediatric dental and vision in that state. So the other, Florida, Texas, were just pediatric vision. Maryland has both dental and vision for the kids. So HMO on and off exchange, silver, bronze, silver, gold, open access, no gatekeeper, very similar as before. Big difference again was the pediatric dental and vision plans. There are the plans there. As I mentioned, we're on and off exchange. If your client is looking for an off exchange type product, we need to go to your producer toolbox at wellpoint.com, where you can go in there and create yourself a quote. He knows how to do that. I'm going to go through that. Overall, we are going to be doing some brand marketing in these new states under the Wellpoint. You may see, if you live in one of these states, you probably or hopefully will see some commercials, social media ads, billboards, basically things that are just really going to try to drive some brand awareness that we are there as an option in the ACA space. Hopefully, if you're offering these plans and products, people will say, oh, I saw that wherever. So just giving you a little bit of notice there. You can see these aren't saying call us. This is more of just a brand awareness campaign. We do have a broker support team that is available 8 to 5 local time. That local time could be wherever you are. We do have a call center on the East Coast in Kentucky and one in California. So we have pretty much all the time zones covered. And I would assume that as open enrollment gets started, those kinds of operations will also be expanded. If you are too busy, you can always email broker support at brokersupport@wellpoint.com. That's it for Wellpoint. I'm open for questions. If anybody has any questions, wait to see if anything pops up before we jump to the next one.
Nope, I'm not seeing any questions. Let's see. No, we're good on that. Any idea if this can be used with Bay Care in Pinellas County?
I got to go back. Is that in Florida or Texas?
I believe that's Florida. That would be my guess.
It is Florida, Pinellas County.
I'm sharing my screen here just to make sure these are the counties that we're going to be available in for 2025. I think you said Bexar County. I don't see that on here.
Used with Bay Care in Pinellas County.
Yeah, I don't. If it's not listed on here, then no, we are not available in that area as of yet. I say that because we more than likely will be continuing to add providers throughout the state, which means that we will then expand into areas that will, as long as we are allowed to, based on provider and adequacy, network adequacy.
So I apologize. So you do not have availability in Pinellas County as of yet for this 2025, correct?
They're in Pinellas. It's right there.
Okay.
Well, No, we can talk later on it, and we can get more nitty gritty at another time. Mark, I have Oscar ready to go. Would you want to hop on after them at your normal time with the normal Anthem coverage?
I thought 1:30 was my time, but it's fine.
Yeah, in half an hour here. We had you hop over a little early because our signal rep wasn't able to get on. But we can have Jocelyn, are you ready to go?
So what time do you want me to be back on?
Why don't you just continue, and then we'll have Jocelyn hop on with Oscar right after you.
Yes, I'm on.
Okay, Jocelyn, are you ready to go, or are you ready, or are you going to hang out a bit? Okay.
Okay, I'll come back in about 30 minutes, 25 minutes. No problem. Or I'll just stay here and wait for you to tell me of that.
That works too.
Yeah, no problem.
All right, Jocelyn, I'm making you the presenter.
Okay, sounds good. I'm actually in Florida, so if I lose connection,
we'll switch it over to Mark if you lose connection, and he can keep going.
Yeah, for sure. Okay, so sorry, I want to make sure that we are okay. Here we go. You can see my screen.
Yep, we can see it.
Awesome. So hi everyone, we are Oscar. Today we're going to be talking a little bit about who is Oscar. I'm sure a lot of you already are familiar, and if you're not, we'll touch base. We'll talk about the new products and announcements, the member service, as well as that broker experience, a 2025 portfolio network overview, and a little conclusion. So my name is Jocelyn Castillo. I'm the sales executive for Florida. I've been working at Oscar now for 4 years, so it's been quite a while. In Oscar years is like 10, so it's been a long time. A bit about Oscar, we started back in 2012. It was founded in the individual market. We are a full stack technology platform. We started Oscar in 2012 to create a health insurance company that, puts the member priority first. And we have grown quite a bit. I mean, it's been more than 10 years now. We have 1.6 million members across the nation. This is our current ACA footprint. 1 in 14 individual ACA lives belong to Oscar. So 504 counties is where we're located in 18 total states. So, we're very happy with where we're at today. We love to say that we're bringing the Oscar magic to more people year after year. Our current NPS score, this is our Net Promoter Score, is 66. Oscar celebrates with these leading results. I think the other company that has the score is Apple. So you can kind of understand the caliber of where we stand with our members. They're very, very, very content with Oscar as a company. With that, we have 83% of member retention, which, for anybody that works this industry, that's a huge number. So we really pride ourselves of the service that we provide to our members. We continue to chart the course of individual insurance. This year, we're going to be, we are tech first, but we want to make sure that we're bringing out new products and new features, especially to the Spanish speaking community. So this year we are going to introduce the Spanish first experience, which will include 2 things. We have what's called Hola Oscar and Buena Salud. Hola Oscar is any member who has the primary language is Spanish is going to get your entire experience in Spanish. And then we also are introducing to the market for the first time in history since ACA the first Spanish plan on the marketplace. So that's going to definitely be innovative. We're also introducing our HMO guided plan. This is going to be in Texas and in Georgia. We have enhanced our broker tools. We're going to touch a little bit of the ICRA specific portfolios, and we'll touch a little bit more oversight on how we are working to actively protect your book. So if you don't know what ICRA means, it's individual coverage, health, and reimbursement arrangement. The as you can see, the ACA market is definitely growing, and there's about 50 million ACA members today. We want to increase the risk stabilization, and then we want to focus on the employee choice and consumerism part of ICRA, which essentially what ICRA does is that instead of getting subsidy by the government, you get a subsidy directly coming from your employer. So we'll touch base on it here, or the new products that we are releasing. As I mentioned, the HMO plans are going to be in Georgia and in Texas. We have new broker portal updates, and then the Spanish-led experience that is going to definitely be well received by our members. So a bit more on ICRA. Sorry, I don't want to jump around, but a bit more on the HMO guided care plan. It is in Texas and in Georgia. We are streamlining the referral process, meaning that this HMO plan is going to be very different to what you may already be used to. The HMO plan is going to work sort of like an EPO, where if you have the HMO network in your area and in your county, and if there's another county that has in your same state the HMO network and you find yourself there, you can also visit the providers in that. So it works across county lines, so as long as there is as long as the providers are in the HMO network. So it works almost like an EPO. We are also being very referral process. Our members can actually check the status of their referral directly from their broker member accounts. So they'll be able to log in, whether they do through desktop or they do it through the application. They're able to see the status of their referral, and then we're making it super seamless to have a PCP selection. We're going to push that our members select their primary care doctor if they have an HMO plan. We are working with 2 really good networks, both in Georgia and in Texas, for these HMO plans. So essentially, if your member is already going to the networks that I'm going to tell you, I would recommend that you place them in these HMO plans so that they don't have any change in their coverage just because they're already going to these providers. So we're going to go beyond the basics for Spanish-speaking members. We're introducing Hola, Oscar, and Buena Salud to provide the full Oscar experience in Espanol. Oscar Spanish first plans and experience help members keep the members engaged. So we are going to be providing Spanish-speaking providers in care and Spanish-speaking care team. So Hola, Oscar is where we're going to make sure that the entire As far as the broker experience, it is changing a little bit. We have updated new features in your Oscar broker accounts. Now you can see real-time insights. For example, your auto pay. You're going to be able to see the percentage of how many members you don't have on auto pay, which I think it's very important. You want to decrease this and have it, I would say at a 50%. Just so that you can secure 50% of your commissions month after month. So I would try to make sure that auto pay is lower every single month so that your members have the auto pay function, and also you can secure your commissions month after month. We also have the overdue payments. You're going to be able to email your members directly from your broker portal, letting them know that they are overdue on their payments. And we have the risk renewal. So you can also send a reminder to your members who you have yet to contact for their renewals. You can go ahead and send them an email saying, hey, I've tried contacting you. Don't forget you have to renew your Oscar policy with me. So I think this is very important to you have the first touch contact with your members in regards to their renewals, and these will be a bulk email outreach that you can do as well. Our enrollment platform, we have Oscar works directly with Stride. We've been having Stride now, I would say, for more than 2 years. It is very easy to use. We're going to be having trainings. You can visit hioscar.com and join our trainings for our enrollment platform. It's very easy to use. If you have used Health Sherpa in the past, which I'm sure you have, it's very similar to Health Sherpa. It's just that we use what's called Stride. Again, you can also use any other third-party platform, or if your member has an account already, you can use healthcare.gov. We are here to serve you. This is our broker resources. You can copy the email and the phone number to get in touch with our broker services. I'll give everybody a moment to copy this. And then our 2020 plan portfolio, we have not changed much of the plan portfolio. This is specifically for Florida. Our Bronze Elite continues to be one of our very popular plans. Again, you can see why, right? It has a $0 deductible, or RX is $6,500. The out-of-pocket max is $9,200. I always say that this plan is like a emergency plan, just because if you have members that don't generally use their coverage throughout the year as much as somebody who may have a precondition, or somebody who doesn't visit the doctor a lot, this is a really good plan to have for just one of those, like, just in case, right? So you're paying really low premiums month to month. You're covered, you know that if something happens, you have coverage, and you know that you're not going to pay out-of-pocket max more than $9,200. So it's a good plan, again, just because it has a lot of co-payments for the most common needs. I think it's best for customers who want the affordability of a bronze plan with a good specialist co-pay as well. One of my favorite plans is a Silver Simple PCP Saver for the members who have a CSR of 150. Again, deductible here is $0. The out-of-pocket max is $1,650. It has streamlined co-payment, except for the emergency room is a 20% co-insurance. But when you look at the out-of-pocket max, then it's not really much to pay for ER. It is an EPO plan that provides members the ability to choose any PCP, and it has no referrals to see a specialist. It does also include a $5 copay on mental health visits. So if you have members that want to see therapy, etc., they have a really low copayment as well. It has a rich pharmacy benefit to help members save on their medication. I think it's best for members who do use insurance, who do have a precondition, who need to be going to the doctor constantly. So again, very, very good plan. And then if you have, those members that really need a really good care plan, I will say the Silver Elite is very good, just because the out-of-pocket max is at $1,100. It is co-payments across the board, including ER. We love it because it has co-payments, low deductibles, low OOP, and it's a non-gated EPO plan, no referrals to see a specialist. And I think consumers are very happy and are looking forward to having a co-pay heavy plan at an affordable price. We have introduced, again, the chronic condition plans. If you sold in South Florida, I would say not last year, but the year before that, you do know about the diabetes plan. We are introducing the new chronic care CKM plan, and it's a really great plan, really. I think the chronic care plan is going to cover cardiology, diabetes, and CKM. So very good plan to have for the members, who need to visit and just need heavier co-payments. The chronic plan includes $0 PCP, $0 specialist, $0 behavioral health, $0 labs, $0 for tier 1 RX. It has a $100 insulin cap monthly, $0 diabetic foot exam, and $0 diabetic eye exam, as well as a $0 pulmonary rehab with 0 carb, cardiac rehab, and 0 oxygen. So really good. The $0 labs include endocrinologists, pulmonologists, and cardiologists. Again, really great plan for members who have or are preconditioned for a chronic condition. Again, as I mentioned, if you are looking to sell the chronic condition CKM plan, this is really good for members who have anything with cardiovascular disease, kidney, and metabolic health. The Silver Simple Diabetes plan is going to be another plan. It's going to be, I will say, just focus on members who have diabetes. Just to touch base here, maybe you want to take a screenshot of this one. This is where these plans are going to be in the states. The chronic care plan will be in Arizona, Florida, Georgia, Ohio, and in Texas is going to be as an HMO plan. And then a little bit more on the IFP network overview. In Florida, we do have, across the board, we have a robust network. We're going to be in Florida, Broward, Miami-Dade, Orange, Osceola, and Palm Beach. We still have our virtual primary care and urgent care providers at $0 copayments. We have our 24/7 virtual urgent care for urgent diagnosis, prescriptions, or refills, and you can talk to someone as little as 15 minutes. And as I mentioned, we are going to have the chronic condition plan in Florida. We are expanding in Georgia and 17 new counties. I think Georgia is going to be one of those states this year that if you sold those last year, you're going to know that we were very competitive in our EPO, but we are not just going to be competitive in our EPO. We are introducing the new guided HMO plan. And as I mentioned, this plan, it's going to have a strong network. We are working with Emory in Georgia. That's going to be our HMO. Our HMO network is going to be Emory, and it's going to be in DeKalb County. It's not listed here because these are all the new counties, but it's going to be in DeKalb County. We are partnering with Emory. They are one of the best hospital systems in the state. El Paso, as well as El Paso and San Antonio. Now I'll share the Texas area, but if you're also selling in Georgia, in Metro Atlanta, we also have Wellstar, and it's one of the top facilities in this metro. In North Carolina, we are expanding into 12 new counties. I think we're going to be slightly competitive in North Carolina as well this year. In Texas, we are going into one new county called Hidalgo, but we are going to be competitive in El Paso and San Antonio. We'll be quite competitive in these two markets next year with our new HMO guided care plan. As far as San Antonio, we are working with Methodist and Baptist for the EPO, and Baptist is going to be our HMO network plan. In El Paso, we're working with Las Palmas del Sol and Hospitals of Providence for the EPO, and we're also working with Hospitals of Providence for HMO network. So again, if you have a member that's going to get, an HMO guided plan in El Paso, and they see themselves in San Antonio, they can cross county lines and be able to use the San Antonio Baptist network because it's in the HMO network as well. So it kind of works like an EPO. In conclusion, this is the team. We are small but mighty. You have myself and Amanda who work the Florida state, and then I just noted everybody else. If you want to chat with Ari about Texas and Georgia, you can, and then Jarrett Weasley, he's the Georgia rep as well as New York, Virginia, PA, North Carolina, Ohio, and Tennessee. And then, you've chatted with Madeline before. She's our national sales director. So again, make sure you register. So any upcoming webinars that we are having state webinars where we go in depth, where we're going to be competitive in each state. So I will highly recommend that you join us. And again, thank you very much for having me today.
Awesome. Thank you, Jocelyn. I think the only question we have was, is Oscar for sure not going to be on Health Sherpa this year?
Yeah, so our partnership with Health Sherpa ends at the end of this year. We won't be under EDE sector, so you won't be able to have, the facilitated quick way to enter an Oscar application, but you can still quote us. You're going to see your plans still in Health Sherpa. It's not confirmed yet whether or not we're going to have the double redirect, which is basically when you start the application on Health Sherpa, you go through healthcare.gov and then you bring the application back to Health Sherpa. That has yet to be confirmed. I think we'll know more towards the end of this month, like right before open enrollment.
Okay, perfect. I think that's all we have then. So thank you so much for spending time with us here and running through all this.
No problem. Thank you guys so much for having me. Have a great day, and anybody in Florida, stay safe amid the storm.
Perfect. Thank you. Mark, are you ready to go again and finish up?
Yep, I'm here. Bear with me 1 second.
Perfect. I'm switching it over to you.
Yeah, I apologize. The time was 1:30. I'm East Coast time. I didn't realize it was 6. I'm glad I got on early.
Yeah, no, there's no problem. Yeah, so you got as much time as you got the full 30 minutes here if you need it. If not, I can always run through some Cigna United Healthcare stuff since they're unable to make it today. So take as much time as you need, and if I need to squeeze those in to fluff the time for the next one, I can do it.
Yeah, one of the things I think that we'll see on this is that there's a lot of similarities between the Wellpoint tools, member tools, broker tools, etc. That this Anthem deck will be go through fairly quick. All right, can you see everything? Is everything look good?
Yes, you are good.
All right, perfect. Well, again, thanks again for having me. My name is Mark Apagrossi, and I'm with Elevance Health. In Elevance Health today, we're going to be looking at the Anthem Blue Cross and Blue Shield plans and availability. So talking about Elevance Health, just kind of how that all works with the rebranding and the different companies that fall underneath it. Talk about member broker tools, talk about some of the product updates and broker support. Again, if you do have any questions, yeah, just let me know. So again, I think I mentioned this again, but a couple of years ago, the company rebranded itself from an Anthem name to an Elevance Health. Elevance Health is now the parent company. The brand of the family, the brand of companies underneath it, which are all insurance type of products or networks or whatnot throughout the country. But the more popular ones, the one we just talked about, was Wellpoint, which offers Medicare products, products and Medicaid in certain states. But we are expanding into Florida, Texas, and Maryland under the Wellpoint ACA brand. And today we are going to talk about some of the Anthem Blue Cross and Blue Shield products in our 14 states. So we've been doing ACA since the beginning. We know how to work it, make sure it's everything. We understand how it works and the ins and outs to make it work. So looking forward to the expansion. Really, everybody knows the Blue and understands the power of the Blue brand. 1 out of 3 people all have a Blue Cross Blue Shield card in their pocket. It's actually 1 out of 8 people actually have an Anthem Blue Cross Blue Shield card, which is a very powerful brand, one that people recognize and one they feel comfortable with, both on the group side, Medicare side, and on the individual side. These are the 14 Anthem states that we operate in. I typically say we are in 14 states, but New York, we don't really pay commissions or market those plans. So for simple, we're in 14, really only sell in 13 states. So we do have member tools out there. If your client has any questions or wants to, access to their information, they can of course go to anthem.com, go on there and register themselves as a member. From there, they can find their ID cards, have pretty much access to all their healthcare information like billing, claims, prescriptions. They can also refill prescriptions through Carelon, which is our pharmacy benefit manager. Find pharmacy, find doctors, and also, of course, see an online doctor through our vendor, Live Health Online. If for some reason you can go out there and search for a doctor or search for a guest, on the Anthem site, you just pick the state and make sure you choose the right network, because in the Anthem states, not only are we offering individual plans, Medicare plans, assortment of different large group, key group, lot of different networks out there under that, so it makes it a little bit more difficult. So it's important to choose the correct network. As you remember, and if you were on the other call earlier about an hour ago, I hit this, and I'm going to hit it again. This is a phenomenal tool that your members have access to once they become once you offer them an Anthem Blue Cross Blue Shield product. This gives them full access to all their benefits and claims information, gives them access to their ID cards. They can do payments, order prescriptions, view download records, find doctors, whatever. Also have access to virtual care. So the Sydney app, if you write something down, if you write anything down, make sure you bring this up on your sales calls and get them the information and make sure they know how to download it and have access to it. Once they have access to it and they start playing around with it, there's no need for them to call you as an agent, broker, agency for servicing because they're going to have everything they need right there at their fingertips. It does have a 4.8 star rating on the Apple Store. We have close to 60 million people use it. I use it personally. On top of that, it's in English and Spanish. People can also, when you go out there and do a virtual visit, you can also see a therapist for stress, anxiety, depression, family issues, or other health concerns. You can also make an appointment with a therapist if you need. Mental health is a big issue nowadays in our country, and making sure people have access to that type of care is important. And they can do that from the comfort of their home, car, office, work, wherever that might be, library, through the Sydney Health app. All right, talking about some of the broker tools. So we do have Producer Toolbox, which is out there, which is a tool. We're going to talk about the Anthem Broker Hub. And so at Anthem.com is where you would be able to go and have access to your Producer Toolbox. If you were on the other call earlier, I will say that it's the same Producer Toolbox. There's not going to be multiple toolbox out there depending on if you're under one brand or the other. It will all accumulate here under the Broker Toolbox. Anthem.com is a place you can go and get access, register. You should be registered if you're appointed with us already. You can go down there and search for your clients, pull their ID cards, again, find billing reports, late reports, identify what members are aging off their parents' plan, turning 26, or aging off the plan altogether, they're turning 65. Complete access to all the summary of benefits, prescription drug lists. More importantly, as your agency, an agent book of business grows and you hire somebody else on, we can give them, you can set them up as a delegate so they can then go in there and have certain access to certain items that you want them to have access to, and not access to certain items that you don't want them to have access to. So it's a pretty cool little system there that's available to you as a licensed broker with us here at Anthem. Anthem Broker Hub this is where we house all broker information. At the Anthem Broker Hub, you can find everything you need to know about the individual plans. You can find product grids, benefit grids, network maps. There's also marketing material out there, both in English and Spanish. There's information about the Sydney app. There's information about the Producer Toolbox. There's a lot of great stuff out there that you have access to. No login password is needed. You just go there, search for what you're looking for, download it, review it. It's all there. So I put the QR code in there too if you want to take a screenshot, take a picture, or write down anthembrokerhub.com. As I mentioned, the Sydney app as well as the Anthem Broker Hub are two things I would say if you're going to walk away from this. Those are the two things that I would ask you to jot down. Things to look for, one of the things that we saw is that the out-of-pocket max are actually decreased this year from years past, which is kind of different. Very similar in terms of our plan names. We'll have the Anthem brand. It will have the network name in there. In some cases, in most cases, it will be a pathway name or a pathway network. You may see a variety of different ones depending on the state. Adult dental vision, again, we talked about the virtual PCP, select, and incentives. Those are, well, we talked about it on the last call. I'm getting these calls mixed up, so I apologize. One of the things that's different is Healthy Heart. That's a kind of a new one that you'll see in a couple of states. The Healthy Heart plans are available there in New Hampshire, Ohio, Indiana, Wisconsin, and Missouri. The Healthy Heart plans give people that are concerned about heart or have heart issues access to a cardiologist with a PCP copay. Also, if they need or looking for nutritional counseling, they can access that as well with a PCP copay. And also select heart tests are also at no cost in the Healthy Heart plans, which are available in those 5 states. Excuse me. So those are pretty cool. I just wanted to share that. The incentives, again, those are all embedded into the plan name. Again, it's a $50 for the wellness exam. That's it, getting that taken care of within the first 90 days for the health assessment. As I mentioned before, that health assessment is more than just telling us about yourself. It also tells us about yourself, but it also gives us some information to see if they qualify for additional assistance. New for 2025 is our social care program, our community connect care and ground game help. This helps people that need help with housing, utilities, food, or transportation. Once they complete the assessment by using the My Health check-in tool on the Sydney app, they can determine eligibility and someone will reach out to them direct additional assistance. It's a great, easy assessment. They get $25, gift card of some sort. But again, it might be more than 25 depending on what kind of assistance they may be looking for. We do have $0 select drugs. These are most commonly used generic drugs that your clients, these members have full access to at no cost. The QR code will bring it right to you, bring you right to it. And also in Connecticut, Nevada, Indiana, we will have some embedded adult dental vision. It is the Dental Prime Network as well as the Blue View Vision Network. Georgia is just a quick update on some stuff here in these 14. Georgia, if you're familiar, is going to a state-based exchange. With that means a different type of certification. Georgia's unique with their Georgia Access is that state-based exchange will still allow you to use third-party EDE platforms like Health Sherpa to continue to quote and enroll individuals into their into that state-based exchange. Georgia is the only state that has that capabilities, from my understanding. Meaning there might be another one, but I'm not sure of it. I will say that Georgia and the Metro Atlanta and Columbus are expanding into a new low-cost product. I want to say it's going to be called the Blue Value plans. Those plans, if you want to go take a look at the Anthem Broker Hub, go to Georgia, you'll be able to see kind of what those plan structures look like. My understanding is that we're going to be either the low-cost silver or the second low-cost silver. So if that's something that your clientele is interested or has access to, needs access to in Georgia, we're going to be a good player there. I will say that it does require a separate appointment. Make sure that if you're not sure, you can go to your broker toolbox, click on that little blue thing up in the top right-hand corner, check your appointments through the toolbox. If you're not sure if you're doing it right, call broker support and they'll be able to check it for you. We are expanding into 5 more counties there in Indiana. We are changing the network name in Nevada from the Pathway to Blue Priority PPO. Maine has a travel assistance program which reimburses for travel into Connecticut, Massachusetts, New Hampshire for select services. Those asterisks are there to make sure that it's just if somebody is going through something and needs care in one of those other states, That's what that is for. It's not necessarily just to get, you know, to go to Connecticut because that's where your doctor is. It has to be one of those select services that one of the athletes is there. Maine went from a 4 rating region to a 5 rating region state. Missouri now expanded additional networks into Springfield. In Wisconsin, if you have members in Wisconsin that are on the blue preferred POS, those plans are discontinuing in the list of the 8 counties below. This is just a quick review of just all the states and what's going on in there. Not really a whole lot of change. And Connecticut in terms of networks or availability, nothing really changed there. And New York, again, not really worried about it. Virginia goes on and off exchange, HMO, EPOs, POS off exchange. I mentioned this here, that's that Blue Value Network expansion into the Atlanta as well as Columbus. Little expansion there in Indiana. So not really much to chat about. I just kind of did that on the last couple of slides earlier. Any questions that anybody may have that I need to go through again, make it a little bit more clear?
Nothing that I'm seeing. Yeah, no questions coming up. So,
well, like I said, I mean, the big one really is the broker hub. Make sure you jot that one down and make sure you download some of the information about the Sydney app when offering these plans. It really is it's a game changer in terms of the member experience. And so I encourage people to, push it when you can. And good luck this open enrollment for you guys in Florida, man. Hunker down and hope you guys stay safe. And thank you again for the opportunity to be with you guys.
no, for sure. Thank you for hopping on here, Mark, and presenting everything that you guys got.
Awesome. Well, let me know if you need anything else. All right. Appreciate it.
Okay, can you see the product training screen? Okay,
that
perfect.
Is perfect. We can see it.
Awesome. Well, thank you so much for having me, Taylor. I really appreciate the opportunity to present to the group. My name is Krista Seaton, and I am a sales operations manager and also a broker accounts as well. So I wear 2 hats, and I will be sharing with you all of our contacts for both our sales support team, that's a resource for the broker community, as well as our broker account management team that are also here to support you. So I will share all of that with you guys here in just a minute. But to kind of dive in about who CareSource is, for any of those of you that are on the phone today that know about CareSource, you've sold our products, but you're not overly familiar with who we are as an organization. We are a nonprofit health insurance company, and we have a very rich history in serving the low-income, at-risk Medicaid population. We started over 30 years ago in Dayton, Ohio, and we started as a Medicaid company. And so we have worked with that population for many years, and then the ACA came around, and leadership at CareSource said, we need to kind of be a part of this next life cycle for those individuals that are now going to be eligible for this marketplace. We want to continue to be an option for them. And so that's what drove CareSource to become a carrier on the marketplace. And we've also, with our rich history in serving the Medicaid or low income population, we have found a space for ourselves in the dual special needs product as well. So we've got those 3 products across Arkansas, Georgia, Indiana, Kentucky, Michigan, North Carolina, Ohio, and West Virginia. And between those states and on those 3 products, we have over 2 million members. I think it's around 2.12 million members now to date. And so it is at the heart of who CareSource is. Our mission is to make a lasting difference in our members' lives. And we do that by improving their health and well-being. So just a little bit more on that topic. It is the vision for us to transform our members' lives so that we're making a difference. But we do that through innovative health and life services. So not only are we going to give our members, obviously access to providers and pay those claims for them, but more than that, we see that we need to treat our members from a holistic perspective. So it's not just their medical conditions that we need to treat in order to improve their lives, but we need to look at those social aspects of their lives. What are the external things that are impacting our members' lives? And so we created some programs, and we really were kind of a game changer, or we were kind of some of the first to start addressing social determinants of health. And really, when it was first started, just like our heritage, we were looking at our Medicaid population and how can we improve their life? What are the things that are impacting their overall health and well-being? And of course, as everybody could assume, housing, food, and transportation were some of the major things that were impacting their lives. But then as we started to broaden this category and say, well, we need to help all of our members, what are some things that we can do for our marketplace members as well? We started, looking at some other areas of life. And I want to always make sure that I approach this topic with our broker community because of the relationships that you have with your clients that are our members. I know that you oftentimes get told when they've recently became empty nesters, and that's just kind of a new part in life for them. But you also know, as you are sitting across the table or on the phone with them and you're looking at products for the upcoming plan year and thinking about enrollment, and they're sharing with you their challenges, right? Whether it's financial or, whatever it might be. So a lot of things about their lives. So just know that Life Services is offered in Georgia, Indiana, and Ohio. And this particular program is a 24-month program for an individual. And even in the event that they're enrolled in the coaching program for a year and they leave CareSource, they're still eligible for that program for up to 24 months. But this can look like a wide number of things, just needs that they might have. So for instance, they're telling you, there's this job that I really want to apply for, but I don't really feel comfortable. It's been a long time since I've updated my resume or done an interview, and maybe I don't have things to wear. Well, CareSource life coaches can help walk them through those things, building their resume, interviewing skills, giving them resources to help with clothing that they might need. Say that as you're talking through their budget and finances because they're really stressed out about the healthcare cost. We can actually help them also with budgeting and financing classes. Say they need access to education because there's a certificate that would just give them an edge or allow them for a promotion in their job. There's so many ways in which our life services program can really be a game changer for your clients. And I just want to make sure that you understand that they do have access to that on the marketplace side. And again, those states are Georgia, Indiana, and Ohio, where they have that access. If they want to participate in this program, if you want to help facilitate that relationship, you can send them to caresource.com and they can search in the toolbar Life Services. And then they would select the state that they're in, and then they would just put in their email address and a phone number, and then a life coach would contact that individual. So just one of the ways in which we are transforming lives, and you can get to be a part of that with us by providing education to your clients. So, at CareSource, we basically put our money where our mouth is. Nonprofit health insurance company, 90% of the revenue that's generated goes back to treat our members, but not just for their medical conditions. It also goes back to those innovative life services programs that we do in changing their lives. And so one of the other pieces of resource that I always like to educate our brokers on is the My CareSource account. This account, I think, helps fill some of the service needs. I think the number one question that most of you probably get is about an ID card. So if you go to caresource.com and either whenever you're first educating a member, you would tell them to create an account, and they would need some information, just like any other account, their member ID, email address, things of that nature. Once their account is created, they can print a temporary ID card they can request a new ID card when they lose it. But if they download the mobile version of this through Google Play Store or the App Store, they can also pull up their ID card in the event that maybe they forgot their wallet in the car. They can get their phone out, show at the pharmacy, here's my ID card through their mobile device. Other things they can do through here, they can search for doctors, they can look at their past claims. In the event that they're engaging in preventative activities that are appropriate for their age and gender, they can claim those rewards in their CareSource account. So just always something that I like to let our brokers know so that you guys are aware, and hopefully it helps reduce just a little bit of service work on your end as well. But really, I think what I'm here today for, and I'm sure you guys are all wanting to know more about the products that we're going to be offering on the marketplace for this 2025 plan year. Real quickly, before I dive into products, I'm just going to go through each state service area just to make sure that you're all kind of aware of some of the changes that will exist for next year. In the state of Ohio, we will not have any changes in our service areas. Right now, we are in all but 2 of the counties in the state. That's Knox and Athens. We're not currently in those 2 counties, but we are in the other 86 counties in the state of Ohio. For the state of Georgia, we do have some expansion, and that is designated in a darker purple in this map. So we are doing some expansion in that Augusta area on the eastern side of the state, and we're kind of filling in some other gaps as we move farther south. Over in kind of that Columbus region, we're expanded into 5 counties there, and then we have a couple other in the northern territories for 2025. I will tell you that it has been a goal of CareSource to kind of broaden that and continue to expand across the state of Georgia. So we're hoping to see some more purple as we move to plan year 2026. So just more to come on that in future years. Now, Kentucky is a state that is going to look a little bit different next year. We are currently, as of right now, in 100 counties there, and that whole eastern side of the state is purple. But for 2025, we have had to make the business decision to remove ourselves from 27 of those counties. So again, I think it's rating areas like 5 through 8, I believe, is where we're taking those 27 counties from. If you do have any additional questions on that, the level of impact, I believe there's around 43 or 4,400 members in those service areas. But if you have questions on that, please don't hesitate to reach out to me. For the state of Indiana, we are statewide currently and will remain for 2025. That is the same for West Virginia, statewide. And then we have North Carolina, where we're going to have some expansion for 25. We're currently in the light purple in that Asheville rating area. And we're going to see some expansion in rating areas 2 through 7. That's really kind of in that Charlotte, Winston-Salem area. And finally, service areas, something that is brand new to CareSource for 2025. We have entered into a joint venture or partnership with the Health Alliance Plan in the state of Michigan. And Health Alliance Plan has been around for a very long time, and they have a really good access to network and a very widely recognized name. And we have a lot of experience in the marketplace space, so we thought this would be a really good opportunity for us to partner together and to build kind of their footprint in the marketplace. And it just kind of gives us a way to have an existing network and brand and name recognition in the state of Michigan. So we're going to be in 6 counties there, and that is basically the Detroit, Flint, Michigan area, those 6 counties there. And so that will be something that you will see if you do sell in the state of Michigan. If you do have a license in the state of Michigan, but you haven't gotten appointed for CareSource in the state of Michigan, all you simply need to do is contact sales support and let them know that you would like to add your Michigan license to your current profile, your CareSource profile, and they can get that done for you so that you're ready to sell for CareSource in the state of Michigan. Now we're going to look at some bronze products. A couple of things to just point out as we're looking through this, and Taylor does have the this product presentation. and they'll be able to share that out with you. But when you're looking back at it, or as we're going through this today, just want to point out that on some of these products, there will be designations of either all markets, or it will have specific markets called out that the products are available in. So in the state of Indiana, there will be a low premium bronze product. So it's just that base bronze product with high deductible and MOOP, and then everything has to meet the deductible. So that will only be offered in the state of Indiana. Also, state of Indiana and Georgia, we're going to continue to offer an HSA bronze product. And so not a lot of changes here on that product, but you're only going to be able to see that in both Georgia and Indiana. Now, what is going to remain is the Bronze First product, and that is across all of our markets. It has become a very, very popular product, and actually has become the federal standard bronze product. And we're proud to say that we were kind of one of the first people that had that bronze product with first dollar benefits, and it's become very popular. Not a lot of changes there, just a little, obviously a little bit of increase in the deductible and MOOP. But everything else has stayed the same on that Bronze First product. And Taylor, if I get to move in too fast, let me know. I have done this presentation so much that I just kind of tend to speed right through it. And so if you're like, whoa, slow down just a bit, let me know.
You got plenty of time. You still got like 20 minutes, so you are good to go. So.
Okay. On the silver side of things, this is where you can see that CareSource is really starting to kind of invest in that silver product. So we've got 2 brand new products. We've got some enhancements to our diabetic product for next year. But if we just want to kind of go backwards just a scotch, we're going to continue to offer our low premium silver product. And if you've sold CareSource products at all and have looked at a silver product for us, 9 times out of 10, it would have probably been that low premium silver product, because that's typically our obviously lowest cost premium price. And so not a lot of changes on that product outside of deductible and MOOP shifting just a bit. The Silver 5000 product is also, it's just that core or standard silver product that will be in all markets. For Kentucky only, they have a different kind of core silver product, and that's kind of based upon that state-based exchange, and it's just a few little nuances in terms of the out-of-pocket max and the co-pays. That's kind of more of a core product for the state-based exchange in Kentucky. The low deductible silver product is something that we kind of did away with in all of our markets last year outside of West Virginia. West Virginia wanted that product to continue to be offered. So we kept it last year in West Virginia, and we're going to keep it again in West Virginia as well, because that's what they have requested. But the diabetes silver product is something that was brand new last year. And so we have decided to keep it again this year. We've made a few tweaks to it. So obviously low deductible at $4,000, and you can see that the PCP is $30 and the specialist is $50. Now, if you did sell this product last year or took a really good look at it last year, we did have a specialist visit was $80 last year. And we take a lot of feedback and insights from our brokers. You guys carry a lot of weight for us. We know that you're the ones with the experience and the relationships. And we heard from you that, that was too high, that $80 was too much. Somebody that's going to see their endocrinologist regularly did not want to pay that high of a price tag. So we made the adjustment to $50 this year based upon your feedback. The diabetic silver plan, outside of that low deductible, it has a lot of rich benefits that are available at zero cost to the member. I will actually dive into all of those benefits here in some upcoming slides. So we'll talk a little bit more about what really truly kind of makes that diabetic plan stand out outside of just that deductible being low. So next to the diabetic silver plan is a healthy heart silver plan. So we're really kind of investing in those chronic conditions, covering individuals, kind of at an at-risk population. And again, that's kind of CareSource's where we really have a good signature there. So we knew that in terms of chronic health conditions, that heart was obviously another issue that we needed to target. So we came out with this product that is going to be geared towards working with individuals that have a diagnosis of congestive heart failure or coronary artery disease. And so the deductible on that one's $4,500, and obviously $30, $50 on your PCP and specialty. But just like the diabetic plan, the healthy heart plan is going to have some other carved out benefits at zero cost for the member, and primarily some high cost prescription drugs that I think you'll be really, that'll make it attractive to you. The final new product that we are going to be offering on the silver side of things is a high deductible preventative silver plan that is actually HSA eligible. So we're going to have an HSA silver plan at $5,500 deductible in MOOP. The cool thing about this is while it is a high deductible health plan that's HSA, and so you have to meet the deductible, there are some pieces of this where we have taken some of the zero cost savings of the diabetic plan and from the healthy heart plan, and we're combining them into this plan. Now, we did get a lot of questions from our broker community, like how in the world, if there's zero cost on this plan, how does that qualify for an HSA? Well, CMS is very focused on the unhealthy population and specifically some chronic health conditions. And since we added those pieces that are targeting that population, they approved this plan. So this plan will have a higher price tag. I'll be completely transparent. But if you have an individual that is on those type price tag drugs and they like those HSAs, this could be very attractive to them. So looking at the gold, we are going to continue in all markets to have kind of that standard gold plan with a $1,500 deductible, $30 and $60 on your PCP and specialist visits. In Georgia, Kentucky, North Carolina, and Ohio, you'll see an additional category of gold plan with just some few nuances, a little bit of a lower MOOP, and then some a lower PCP copay in drugs. So just a couple of nuances on that particular product as well. You will have access to a diabetic and healthy heart gold plan. And so low deductibles, and it will have those low copays on visits, but those zero cost testing, durable medical equipment, and formulary drugs will also be a part of the diabetic gold and diabetic and healthy heart products as well. Finally, on all of the product offerings for 2025, we are going to have a platinum plan that we're going to offer in Indiana and West Virginia only. I think our product team got through and built all their products and maybe just got a little bit bored and said, let's try something new, people. And so I know that when I started writing business in 2013 for the 14 plan year, I think there were a couple of platinum plans out in the world then. And they lasted maybe a year or two, and then they just kind of went away. And so CareSource, I think, is just going to try it out. I think from West Virginia, we have a very highly subsidized market in West Virginia. And so I think they thought there might be some application there for this product, and kind of the same perspective for Indiana. So we're kind of piloting this platinum plan with a $0 deductible and a low out-of-pocket of $4,300 for plan year 2025 in Indiana and West Virginia. So that's going to have a pretty decent price tag, as I'm sure you can assume, but we will see how that's adopted through maybe our highly subsidized market. So I was talking to you guys about that diabetic plan. I'm sure some of you on this call maybe even enrolled some folks in it last year. But the great thing, the really rich side of this particular program is the zero cost savings for people on screenings and tests. And you can see those here, obviously A1C. There is also going to be some nutritional counseling that is available from our care management team, as well as self-management education. So they'll be able to receive all of that education, as well as routine foot care. And then, of course, the screenings that go along with this. Durable medical equipment that is zero cost is the glucose, the one-touch Vario, so that with the test strips where they puncture the finger and then read. But if they have a continuous glucose monitor, a CGM, The styles of that are Dexcom G6 and the Freestyle Libre. Those are really the most widely used on the diabetic population, and those are the three that are at zero cost. They can also get supplies, the pen needles, syringes, the lancets, alcohol swabs. They can get those as well for zero cost. This is not an OTC benefit, so they can't take their card and go to pharmacy and pick them up for free. They will need to get a script written by their provider for those items, but they can get that at zero cost as well. Now, on the drug side, if you saw this last year, we did not offer any regular insulins. We only had rapid acting and long acting, and we had, it was Lispro and Aspart, as well as the long acting. But we heard again from the broker community, and so many of you said, if you had Humalog, if you had Humulin, if you had Novolin, a part of this, this would be the easiest sell in the world for me. I could sell this in a heartbeat, and it would save my individuals a lot of money. And so that made CareSource react. We heard you, and we said, okay, we're going to make it work. And so we have added those brand names to our list of $0 for the diabetic plan. Another big thing to mention, I feel like I need to highlight and bold and all the things. The other brand name drugs that are really important and have a high price tag, Jardiance, Farxiga, Januvia, and Janumet. Those are also a part of this plan at $0. So now we're going to look at the Healthy Heart Plan. So again, it has $4,500 deductible, low copays on PCP and specialist, but those $0 offerings on this are, of course, somebody dealing with coronary artery and CHF are going to need to get lipid panels, prothrombin tests, metabolic panels, as well as EKGs from time to time. Those are $0. The drugs that are really important here, Jardiance, Farxiga, and Entresto. I know those are extremely expensive, and they're offered at no cost to the member. Again, on the script, if they need some DME, like a blood pressure cuff and compression stockings, they can get that script written from their provider, and they can get those at the pharmacy at $0 cost as well. Oh, I lost my cursor. Okay, that HSA Silver plan that is focused on preventative measures for heart and diabetes. You can see the different, we didn't completely transfer all of the benefits from diabetes and all of them from the Healthy Heart, but there are definitely pieces of both in here. So on the screenings, the eye screening and the A1C, as well as the LDL screening that need to happen. Preventative drugs, there's a number of your ACE inhibitors, beta blockers, as well as your statins. And then also the insulins and the generic drugs and some of the Farxiga, Jardiance, and Januvia, and Janumet brand name drugs for the diabetic population. All those are included here. Again, the diabetic supplies, alcohol swabs, glucose meters, and test strips, lancets, and all that good stuff is still offered at $0 cost. The major difference that I do want to point out, because I've had this asked in quite a few of the presentations that I've done, the CGMs are not a part of the $0 cost on the HSA Preventative Silver plan. So, but they are on the diabetic plan, just not on the HSA Silver plan. And so it would go against the medical benefit, towards the deductible of $5,500 and then 50% coinsurance. And that is this Preventative Silver plan. CareSource has a telehealth piece that is offered at $0 cost to our members. Our vendor is Teladoc. And so one of the major things I want to point out about this is that it is not only for acute conditions like flu, sinus infections, colds. We also have a behavioral health piece to this. So in the event that you have a member that is having trouble accessing a behavioral health provider, I know a lot of people, I'm in Southern Indiana, and it seems like more and more behavioral health providers are kind of walking away from accepting insurance. And I just kind of continue to see this issue with access for individuals. But we can overcome that with this telehealth piece. And so what better way to be able to meet with a mental health provider from the comfort of your home and your safe space. And so that is also offered at zero cost to our members. So both acute conditions as well as behavioral health, mental health needs can be met through our telehealth piece. It's zero cost to our members through TeleDoc. We have an optional adult vision and fitness benefit. If somebody is looking for vision and fitness and they want to add that to their plans, it's actually called enhanced, whatever the plan name is. One major point of clarification on this is last year, the enhanced plans or the supplemental plans included dental. Our vendor was DentaQuest, and it was really, it never really quite turned out to be as productive of a relationship as we had hoped. We heard a lot of negative feedback from our broker community in terms of provider education and knowing that they accepted CareSource Marketplace or access. Access was another huge issue, as well as the type of provider that was offered. And so we tried to find a solution for 2025, and it was just kind of too late in the game where we had done some RFPs, we had, and then had explored some other options, but we just ultimately decided for 25 that we were going to remove dental from our offerings and terminate our relationship with DentaQuest. So you're going to see that the price tag on adding those two features has obviously gone down because dental is no longer included. So what was $10 to $12 more a month is now $3 to $4 a month for both vision and fitness. Another thing before I move to talk about our vision benefit is just know that CareSource in the past has always included a pediatric dental benefit in all of our marketplace plans. That will no longer exist either because we have terminated our relationship with DentaQuest. So I just want to make that call out. And those different pieces of information will be sent in communications to our members. So I just like to let our broker community know that, because sometimes people can read things or misinterpret letters that they receive, and that might cause a little bit of panic. And I just wanted to give you that piece of information so that you knew to anticipate or maybe help answer questions as you get those from your members. But our vision benefit is with iMed, and we've had a lot of good feedback about access to doctors and the iMed network. That particular benefit offers up to a $250 allowance for frames, contacts, or lenses. It's kind of it's a combined benefit. The other also really good piece of this is it takes 15% off of that laser surgery, that LASIK vision correction surgery. There's also some other cost savings if people want to get prescription sunglasses, or if they do have some sort of remaining balance because they went ahead and got contacts and lenses and frames and they have a little bit left over, they can get 20% off of like any remaining frame balance, as well as just another pair of glasses. They can get 40% off of that. So great offering here. Very, very, it's very general to what you see on a vision side of things out in the marketplace. On fitness, our vendor is Active and Fit. So if you go to activeandfit.com, you can put in a zip code of wherever you're at, and it will give you a listing of all of the standard gym memberships that are available in your area, those brick and mortar buildings where people can go, and they can actually have a free gym membership. You might see a lot of national networks depending upon your area, Planet Fitness, LA Fitness, Snap Fitness. But I will tell you here in Southern Indiana, there is, and I always check Active and Fit just kind of to see what's available to kind of, do a little research. But here in my area, there is a facility called Bob's Gym. It's 3 or 4 locations. They have built a brand new huge facility about a year ago, and it's really nice. Everybody wants to work out at Bob's. Bob's is actually also a part of Active and Fit for CareSource Marketplace as well. So just make sure you check that because it's not just those chain facilities that are in your network. You might see a YMCA depending upon where you're at. You might see, I know there's one in Evansville called The Pit, and it's like where a lot of people like bodybuilders actually worked out. That's a part of the network. So there's a lot of standard facilities included in that. But there is also a premier network that individuals have the opportunity to kind of do a buy-up. So they can look, whenever they're doing that search, it will show standard, those are free, premier, And those premier networks might look like Orange Theory, Cycle Bar, Stretch Lab, Club Pilates, all those boutique fitness centers. So those are all included in that as well. But all they have to do is click on the toggle button next to those premier offerings, and it will tell them the price and what is included in that. For instance, Cycle Bar, if I clicked on that, it said like for up to 5 sessions a month at Cycle Bar, it would cost like $109, which, just to give you guys an idea, in Evansville, like for 5 or more workouts in a month, it's like $169 or $179 a month. So quite a bit of savings for those people that are really, really focused on fitness and that are really interested in those boutique fitness center experiences. Another thing for individuals that want to work out at home and they don't feel comfortable going to a gym, they have like 9 different fitness kits that they can choose from. It'll come to their home. They can pair that with like thousands of on-demand videos that they can do from the comfort of their home. And it really is a great benefit. I will tell you that I've had a lot of individuals that have told me, or not individuals, rather brokers that have said, even when it was $10 to $12 and it included the dental, that they would have some consumers purchase it just for the fitness alone. So hope you've had that same experience. The last couple slides here, I just want to tell you, you as brokers have support from CareSource. You've got different teams of people that are solely focused on you. We're here as a resource to make you be as successful as you need to be. The folks on this slide on the right-hand side, Sharice, Vincent, David, and India, that is your sales support team. If you have contacted CareSource, if you've called that number 833-230 at the bottom, or if you sent an email to our sales support team, these are the 4 folks that are answering your phone calls and your emails. So anytime that you need help with adding an appointment to your profile, if you've got a question on your commissions, if you just have some sort of issue that you need help with, this is the team that can help you. And I hope that you've had a positive experience with them. I get nothing but great feedback. These folks over here are the ones, part of the team that I manage, and they work really hard to be a great resource for you. Now, in the event that you need help with providers and network, you've got a member that has mentioned if you had this provider group and network, then this would be great. These are all things that we can help you with. We're also here for sales strategies. Anytime you need a product, training, anything like that, we are here for you. So on the right-hand side is Ryan Black, Tony Cato, and myself. We are the broker account managers that support the marketplace product. That is our main focus. We do help a little bit with the dual special need product in the event that it's needed, but our main focus is ACA. So please don't hesitate to reach out to one or the 3 of us. If you need to get a hold of all 3 of us, you can actually email us at brokermanagers@caresource.com, and that comes to all 3 of us. We'll see it and we'll respond. In the event that anybody needs help, questions with the dual special needs product, Mara Del Rio is our manager for the BSNP business. So I just want to let you all know that we are here for you. That is who we are. Taylor actually has a copy of this presentation, and I'm sure that will be shared out, but we really want to see you be as successful as you can possibly be. So any way that we can support, just let us know. And that's the end of my presentation.
Awesome. Thank you, Krista. Yeah, it looks like no questions I wasn't able to just answer. Looks like the only one that we really had was if it was in Florida, which I believe would be a no. Are you guys planning on going into Florida?
We have definitely considered Florida, and Taylor, we are constantly asking leadership, when are you opening up in Florida? And we would be happy to support and go down there and help get that set up. So, it's definitely a market that we're looking at, but we're not currently in. So thank you for that question.
No, not a problem. Well, I think that looks like that is it for questions. So thank you so much for taking time out of your busy schedule to show off everything that CareSource has to offer.
You are so welcome, and good luck to everybody this selling season.
All right, Stephanie, are you able to unmute.
Yes, I'm able. Can you hear me?
Yes, we can hear you, and I shot presenter over to you.
Okay. Can you send presenter over to Mike Polino? He's also on the line. He's going to try to share. Yes. Thank you very much.
Perfect. It is over to Mike.
You guys see my screen?
Yep, we see it.
All right. Try to turn notifications off in case my wife texts me.
Understandable.
All right. Thanks for having us. Appreciate you guys
Sure.
working with us here. I'm going to present off my phone here. I'm going to go through our products, and then Stephanie's going to give an overview of the content we have for producers. So first, just a little background on who is Highmark. So Highmark is a multi-state blue plan, or either Highmark Blue Cross Blue Shield or Highmark Blue Shield, depending on the region that you're in. And we serve over 5 million members in Pennsylvania, Delaware, New York, and West Virginia. We have Medicaid business. We also own a hospital system in the Pittsburgh area. We own a dental company, United Concordia. So we're a very diverse organization. For the individual ACA market, we participate on the exchange in every county that we serve. So that is every county and statewide in Pennsylvania, West Virginia, and Delaware. And then there are 21 counties in New York that we also participate in, around Buffalo, and then also Albany up through northeastern New York. If you're not familiar with our markets, West Virginia and Delaware both use healthcare.gov, the FFM platform. Pennsylvania uses Penny, and New York uses New York State of Health. So PA and New York are both state-based exchanges. Neither of which have EDE, so you would need to use those websites directly if you're trying to sell in PA or New York. So I'm going to go through the portfolio that we have here. If you're familiar with Highmark, you'll know that we do have a lot of options that are out there, but we do it to try to provide a relevant portfolio or a relevant plan for everybody out there. We came up with this term, called pick your perfect match, that helps eliminate, the number of plans, not to be overwhelmed quickly. A couple questions you're asking your client, and you can get to a plan that's gonna work for you. So pick your network, find the network of doctors that works for you. This is only applicable in Pennsylvania, in West Virginia, Delaware, and New York. We just offer one network that's very broad. Pick your cost share, which would be focusing on your metal level. And then once you get down to the metal level, you have a couple options that you can decide between for your client, but we think all of them are very good. We don't think you'll be displeased if you get really in any of our Highmark options. So I'm going to try to zoom in here a little bit on the network availability. So like I said, for PA, West Virginia, Delaware, New York, we have a network called My Blue Access. It's a PPO network in PA, West Virginia, and Delaware, EPO in New York. But once you see the My Blue Access name, that is Highmark's broadest network. It is what our largest commercial groups use. It is the premier network that we have, and we offer it to our consumers for ACA. Sometimes you're gonna have to pay more to be able to have that broad network, plus the out-of-network benefits. But know that it is Highmark's broadest commercial PPO network. In northeastern PA, we have little different flavor of the broad network where it's tiered, so still a broad network, but then there are different cost sharing depending on if you go to an enhanced or standard provider. So if you go to one of the enhanced providers, the member will have a lower copay. My Direct Blue and Together Blue, these are PA only. My Direct Blue spans more of Pennsylvania. This is a more traditional narrow network product. It's an EPO, no out-of-network benefits, lower price because of the narrower provider network. So a lot of members like to take advantage of those savings. But that's out there. And then Together Blue, which is specific to WPA's Western Pennsylvania only, so in the Pittsburgh and Erie markets. This is our most affordable plan built around the Allegheny Health Network, which is part of the Highmark family. That's also an EPO. I will scroll over for My Blue Access, My Priority Blue, and My Direct Blue. All three of those provide nationwide access on the PPO Blue Card network, which is generally considered the broadest network in the country. Over 2 million providers are in that network. And when members go to see a PPO Blue provider out of their service area, it will be covered at the in-network level of benefit. So pretty generous coverage on those three products. If we go down to our plan availability, apologize if this is zoomed out too much, but the takeaway I would have from this slide would be that, we offer a lot of the same plans across our service area. We've got a few options at bronze, a couple at silver, and then more at gold. And in some states, we even offer platinum products. Also, the little red dots that are probably difficult to tell on this slide up at the top there, those indicate plans that have an option with adult dental and vision. So again, at least one plan at each metal level has an option with adult dental and vision that's included for people that want the comprehensive coverage. If we go to the next slide with all these colors on it, but the point of this, or what I would like to take away, is just know that Highmark uses clear plan names that try to put as many details as possible in the name so that it makes it easier to identify and compare plans. So the product or network name is always going to be first. Then you'll have EPO or PPO. Those are the only two product network types that we offer. Premier is a term that we use to signify our most generous plan at the silver, gold, and platinum metal level. It's also the only plan that has hearing aid coverage, if that is of interest to anybody, any of your clients. The metal level will be next. You'll see on the example here, we use extra savings silver. That does indicate that the member qualifies for cost sharing reductions. So between 138 and 250% FPL, if they're eligible for those CSR silver plans, you will see the term extra savings silver in the plan name. The deductible will always be in the plan name. The deductible does change for the CSR variants. It is the relevant deductible, not just the base. And then at the end, plus adult dental and vision would be included if the plan includes adult dental and vision. So we'll jump into our CSR, our silver offerings. Because of the way our states do, how our states account for the non-funding of CSR, all of our states ask us to put it all at the silver metal level. So what happens is, because silver is more expensive than gold, the CSR silver plan, the silver plans only make sense if you qualify for CSR because you're getting that enhanced benefit. So just the 87 and 94s are the most relevant. You'll see that on our low cost silver option, while the base deductible is $7,000, the deductible does go to zero whenever you qualify for the 87 or 94 variant. And then on the 94 variant, the PCP and specialist copays are only $1. So you're looking at no deductible and then $1 copays plus generous pharmacy coverage, which is what's on the bottom there. We do have a buy up silver option. In Pennsylvania, this does have $0 specialist visits, but most people buy up because this is the choice that has the bundled adult dental and vision. The low cost Silver Zero is the one that's going to be free, most likely, for those under 150% FPL, and then it's slightly higher incomes depending on the spread between the Silver plans. The vast majority of our Silver enrollment is in this lower cost Silver Zero. Next up is Bronze. We have 3 or 4 Bronze options depending on the state that you live in. West Virginia, Delaware, and New York each have their own standard plans as required by the exchange. So that is not listed. Those are not necessarily popular plans for Highmark. The 3 more popular Bronze plans that we have are listed on the screen here. So we have our Bronze 8900. This offers the most basic coverage with the lowest premiums, $9,000, almost a $9,000 deductible. Once you meet it, though, everything is paid at 100%. In the middle, we have our Bronze 3800. 3800 is a reference to the deductible. This is our most popular Bronze plan. Relatively low deductible for a Bronze plan at 3800, but it has a lot of pre-deductible copays. So PCP and specialist copays are the same at about $65. The copays for labs and x-rays, and then also for tier 1 medications. They're $15, not subject to the deductible. So this is our most popular Bronze plan. We also offer a qualified high deductible Bronze plan, Bronze 7400 deductible and out-of-pocket max, eligible for the HSA. And then this plan, hopefully you can see the name with the dash custom drug benefit at the end of it. If you guys were listening to the CareSource presentation, this is similar to their preventive Silver plan, where certain drugs, maintenance medications, are $0, not subject to the deductible. You just walk into the pharmacy, pick up your medication, and walk out. It would be totally free because of some IRS regulations that allow maintenance medications to be free. So some stats from our perspective: 20 of the 25 most filled medications are on this list, and then 9 of the top 10 most filled tier 3 drugs, which are more expensive medications. Some examples: Lipitor, Metformin, Albuterol, Jardiance, Linsapropyl, and Entresto, all on that list, and all free. So there is a lot of people that enroll in this plan. You're looking at a $0 premium and then $0 maintenance medications. Works for some people, as long as they're comfortable with everything else going towards their deductible. If not, the Bronze 3800 is likely a better fit because of all the copays for their medical services. Last is our Gold and Platinum plans. These are the more popular options that Highmark sells. Again, because of the way Silver is more expensive than Gold, it makes Gold relatively affordable. But then just the clients that are attracted to Highmark tend to be prefer the higher metal levels. So Gold, we have our Gold QHDHP, $1,700 deductible. You can see the benefits there. Works if you want an HSA plan. Our more popular Gold options are the 3 in the middle here, which are labeled good, better, best. Really, the decision here would be trading off between premium and cost sharing. Do you want to pay a little more premium for more generous cost sharing during the year? So you can see the copays, go from 35 to 15. Out-of-pocket max drops as you spend more, and then the pharmacy on the Premier Gold is our most generous, and that's usually why people go for the Premier Gold option. Usually only one tier 3 medication is enough to make the Premier Gold a better value. And then all the way on the right is our Platinum offering. Platinum is only in New York, Delaware, and parts of Pennsylvania. But it is our most generous plan. No deductible, no copay for PCP or specialist. PCP and specialist visits will be free. There's also free labs and x-rays, and then tier 1 prescriptions are also free on that plan. So if your clients are comfortable buying up to our most expensive product, know that there are extremely generous copays, no copays, totally free in exchange for doing that. Quickly move to the supplementals. So if you see a plan that says plus adult dental and vision, that plan is going to have the same adult dental and vision benefits regardless of the metal level. It's always the bronze and platinum plus adult dental and vision are the same. Dental, you see there's a $50 individual deductible. It's $100 for families, and then a $1,500 annual max, the most the plan will pay per person. Pretty generous coverage, 180/50, so it covers all 3 classes of dental medications, 3 free cleanings instead of the 2 that you see most often, 80% on basic, which is fillings, and then 50% on more complicated services like root canals. Some services have waiting periods, but none are more than 6 months. So if you buy the plan for January, you will be able to get dental coverage within the same plan year. Adult vision, a little more straightforward, free eye exam, and then a $150 allowance for frames or contact lenses. Again, that's the benefit no matter what metal level you choose. If you see a plus adult dental and vision, those are your benefits. The networks for those plans should be considered broad. Easier to find a dentist. I know we're coming up on time. I already touched on Platinum. Platinum exists currently in Delaware and New York. We're adding it for parts of Western Pennsylvania for 2025, but then all the states are seeing this change to the new cost sharing with no PCP and specialist copays. So a more generous Platinum plan. If anybody sells in New York, or has Highmark clients in New York, I don't know if that's common or not. Just know that we are launching all new products in New York. There'll be all EPOs with all current POS plans being discontinued. We are not exiting any counties. We are just changing over all of the products. About half the members will be auto-renewed, half will not. Encourage anybody in New York to actively choose a 2025 plan, regardless of whether they were auto-renewed. We have some new non-standard plans in New York with low and no deductibles, and then copays for services. And then also New York, as a state exchange, is expanding eligibility for the CSR variants up to higher income levels. So CSR 87 will go up to 350 and 74 will go up to 400% FPL. That is statewide in New York. That would not just be in Highmark's area. So I'll turn it over to Stephanie unless there are any questions.
All right.
Nope, I'm not seeing any questions, so it's all you, Stephanie.
All right,
Okay.
thank you. Appreciate it.
Thank you, Mike. Can you hear me okay?
Yep, you're good.
Okay, perfect. Okay, well, I'm Stephanie Stanley, and I am the channel sales rep in West Virginia. So I handle all of the agents that sell the ACA plans as well as Medicare plans. So I'm just going to go over some quick operations and compliance updates. On our first slide here, I just kind of wanted to let everybody know, kind of level set on how to access our producer portal. So if you're an agent of ours and you have access to the producer portal, this screen probably looks familiar to you. If not, and you want to become an agent to sell the Highmark plans in any 4 of our states, that's New York, West Virginia, Delaware, or PA, you can actually get with your upline. And they can take care of creating an onboarding case so that you can sell for us this OEP. If anybody has any questions about how to do that, I'm sure you can get with Taylor, or my contact information will be shared at the end of the presentation. Feel free to reach out to myself. But once you get into our portal, if you do still sell Medicare and ACA, you'll have 2 different options here to pick from. If you do not sell both, obviously you'll just have the one that you're selling for us. And one thing I want to mention is we do have a standalone Blue Edge dental product that you can take to basically complement these plans. That is something that you have to be ACA appointed and upline to sell. So once you do your initial appointment to sell ACA, that will also enable you to sell our Blue Edge dental products as well. Okay, on the next slide here, just a quick reminder about how to get documents. So again, our producer portal, it is where you can find a lot of information if you're one of our agents. So if you need to get a paper application, this kind of walks you through the process. If you need an SEP form, ANOC letters, EOCs, those sort of things, evidence of coverage. The one thing I want to mention is you're never going to use a paper application unless you're submitting an application directly to Highmark. So let's say you have an off exchange and for whatever reason you want to just submit it direct to Highmark. This is where you would find that paper application along with the SEP form if it's not during open enrollment period. And then on our next slide here, just some quick reminders again when it comes to submitting applications direct to Highmark. Again, this is going to be on that off chance that you are doing something direct, you're not doing it through the state exchange. So those off exchange applications along with supporting documentation and the SEP form can be submitted to this email box. So we've got the dp_applications@highmark.com. We want to make it as easy as possible if you are going to be doing something direct that you can get those applications over to our enrollment department to get those processed for you. And then moving on to the next slide, this just kind of goes through the open enrollment period and application submission deadlines. This first slide addresses West Virginia, Delaware, and Pennsylvania. I'm sure most of you all know that West Virginia and Delaware are through the marketplace. You can also write applications through Health Sherpa. In Pennsylvania, they do have their own exchange called the Penny. So again, for those that do sell in those states, you're probably well familiar with those different avenues. We also have the enrollment dates up here. So obviously November 1st through January 15th. That is like your open enrollment period for those 3 states. If you're wanting to submit something again off exchange, you could do that through the producer portal during the OEP or via the paper application. Again, applications submitted by 12/15 are going to be effective 1/1 of 25, and applications submitted 12/16 to 1/15 will receive that 2/1 effective date. So again, that's probably just a reminder for most people on the phone. Again, with the SEP enrollments, on exchange enrollments will need to be submitted again through the marketplace in West Virginia and Delaware and the Penny and PA. Again, you can also use Health Sherpa in West Virginia and Delaware. And then, of course, we've already talked about the off exchange via the standard process. Okay, so then on the next slide here, we're going to talk about New York. It's kind of one of the outliers. It works a little bit different than our other 3 states that we are in. Their open enrollment period does run November 1st through January 31st. And again, this is probably just a reminder for everybody that sells in that state. All on exchange OEP enrollment will be submitted through the New York State Office of Health. The off exchange OEP enrollment can be submitted through that producer portal or via the paper app. And then again, applications that are received 12/15 are effective 1/1, and applications submitted between 12/16 and 1/15 will receive a 2/1 effective date, and then applications submitted 1/16 through 1/31 will receive a 3/1 effective date. Again, nothing new here with the SEP. If you're going to be doing on exchange, you would do that obviously through the New York State Office of Health, and then off exchange again is just through that standard process. Okay, and then this next slide, something that we just want to always remind agents is when you submit an ACA application, whether it's on, one of these state exchanges or, direct to Highmark, that policy is not actually going to basically take effect, and an ID card is not going to be mailed out until that first payment is made and posted to the member's bill account. So obviously, if they're going through an exchange, that initial payment can be made right at the time of the application. Those off exchange members, if they do choose to, they can mail in the application along with the check. Or if you do use the email box to send those applications to Highmark Direct, you would just want to give it about 3 to 5 days after we've received the application and once we've actually processed it for approval, and then they can call in and make their first month's payment over the phone. So again, just give us a little bit of time to process it, and then give us a little bit of time to get that bill account set up. because generally speaking, the billing is the last thing to take effect as far as our system and getting everything built into there. So just give it a few days after it's actually been approved before they call in and make the payment over the phone. On the next slide, now this just has to do with West Virginia and Delaware. It has to do with the uptick in fraudulent agent and broker activity on the federally facilitated marketplace, that's the FFM, has prompted an increased CMS oversight on the marketplace agreements. So this is something that's not new. It actually started back in July. It does require agents and brokers to take additional steps to update a consumer's enrollment, even with their consent, if they are not already associated with the consumer's enrollment. Agents and brokers who are new or unassociated must conduct a three-way call with the consumer and the marketplace call center, or must direct the consumer to submit the change themselves through healthcare.gov. Now, I get it. I have a lot of agents that complain about this, and I get it. It's not the most user-friendly thing to do, but unfortunately, just again, due to the fraudulent uptick, that is something that is now required. So in an effort to protect consumers, CMS will suspend and terminate agents and brokers who perform unauthorized marketplace activities. Consumers are encouraged to report any suspected unauthorized activity to the marketplace call center at 1-800-318-2596. Okay, and then on our next slide here, we do have a nice array of materials. So if you're an agent who sees individuals face to face, we do have some nice catalogs and plan comparison guides that are available out on our producer portal. We have a site called Marcom that you can go in there and you can add things. Again, we do sell in those 4 states, West Virginia, New York, Pennsylvania, and Delaware. So if that's a state that you sell and service in, this is definitely an option. Once we get you into the portal as one of our agents, you can go in there and order your material. Also, I have agents that will just have me order it for them. So if that's easier, my contact information will be shared at the end of this presentation. I do service the West Virginia market. It'll also have our other contacts for all the other areas that we service. Okay, and then our next slide. This is just some general resource contact information for our agents. Again, we want to make sure that we are available to serve you and that we are able to answer questions that you may have. So feel free to take a screenshot of this. But the producer portal, again, this is where you order sales kits, marketing collateral. That's just producer.highmark.com. And of course, you would have to be onboarded and uplined and ready to sell, and you'll get your access to that. The ACA broker support, now in some areas it is broken down by the state. So if you're needing like assistance with onboarding, producer portal questions, it's got the information listed here. If you're needing application status, benefits, claims, provider network questions, there's actually a separate number that you'd be calling for the state of New York. But for West Virginia, Delaware, and PA, it's actually the same number. It's that 1-800-652-9459 number. And then on our next slide, this is just the exchange information. So again, probably nothing new to most of you all, where we've got the PA exchange, the Delaware, West Virginia, the New York, and then of course Health Sherpa. Again, Health Sherpa would just be for West Virginia and Delaware. And then on our next slide, this is our ACA consumer websites by region. So depending on where you're writing, where you're servicing and selling those plans, we've got a Northeastern PA, Western PA website, a Central PA, of course, West Virginia, Delaware, Western New York, and Northeast New York. So again, just depending on where you're writing or where your clients are located, these are consumer-facing websites, so this is something you can share with your consumer. They can go out and take a look at our plans. And last but not least is our channel sales rep. So again, my name is Stephanie Stanley, and I do service the West Virginia market. Again, please feel free to take a picture of this. It's got everybody's contact information. So we've got Felicia in Delaware. We've got Evan Kaminsky in New York, Tom Campadell in Southwest Pennsylvania, Bill Glass in Northwest Pennsylvania, Nicole Sherlock in Central PA, Morgan Catherman in Northeast PA, Dan Mann in Southeast Pennsylvania, which is basically that Philadelphia market, and then of course myself. So we are your resources along with our broker support line. And that does conclude my presentation. I don't know if there's any questions or anything else that anybody would need at this time.
I am not seeing any, so yeah, with that, I think we can probably wrap this this ACA kickoff event up here. So I do want to thank everybody who has attended the entire time here. There's a good chunk of you still on that have powered through this day. If you have any questions or anything, or want to get set up with any of the carriers that have presented today, definitely feel free to reach out. My contact information is on here. And yeah, thank you once again.